Based on the evidence of last week, it appears that you do. You threatened to shut down the government. You ousted your speaker. And now you want to set up yet another select committee to investigate. It looks like you have made your choice. Unfortunately, I think your actions will result in even more chaos and discord in this Congress, which is exactly what the American people don't want. They do not want the discord. Ms. Richards, I want to thank you very much for being here today to give us the facts. Your group has been extremely helpful during this investigation, providing tens of thousands of pages of documents. Your cooperation stands in stark contrast to Mr. DeLayden, whose notable absence speaks volumes. And with that, Mr. Chairman, I yield back.
We have agreed to allow the subcommittee chairman to also make opening statements, so we'll now recognize the chairman of the subcommittee on healthcare benefits and administrative rules, Mr. Jordan of Ohio, for his opening statement.
Thank you, Mr. Chairman. Thank you for this hearing, and thank you for your heartfelt remarks in your opening statement. Here's the troubling truth. A picture's worth 1,000 words. You can say all you want that these things were heavily edited, they were changed, but if that's the case, why did Ms. Richards apologize for the videos 2 days after they first surfaced? Everyone knows these videos are, as the Speaker of the House said, barbaric and repulsive. And this argument that we keep hearing from the other side, Republicans want to shut down the government. Are you kidding me? We want to fund the government at the levels everyone agreed to. The Ryan Murray budget, but the levels the levels the president agreed to. We simply want to shift the money from an organization caught doing what they were caught doing and give it to the community health centers. Shift it from the 700 Planned Parenthood clinics, give it to the 13,000 federally approved community health centers. Take the money from the guys doing the bad things and give it to the ones who aren't. Take the dollars from one private company doing what the Speaker said, barbaric things, and give it to federally approved community health centers. Now, if the Democrats insist that in spite of all that, this organization should still get your tax dollars, and that somehow is more important than funding our troops, our veterans, and frankly, women's health issues, and some of the things the chairman talked about in health care, if that's their position, then they can go defend that position. So let's just be honest here. This is what this is really all about, plain and simple, money and politics. Here's how it works. Politicians give money to Planned Parenthood, who give it back to politicians at election time, who get elected, and give it back to Planned Parenthood, who give it back to politicians who get elected, and the game plays on. In 2012, in that election cycle, Planned Parenthood spent almost $12 million in advertising. In fact, $11,874,052, 100% of that went to Democrats. Every penny, every single penny went to Democrats. No wonder they're defending this repulsive game. Politicians give money to Planned Parenthood, they give it back to politicians, and it keeps on going. The nice thing about these videos, it's lifted the curtain. We can now see what's going on there, and that's why we should fund the government and shift the money from this organization to organizations who didn't do this kind of behavior. With that, I yield back, Mr. Chairman.
Thank the gentleman. We'll now recognize Ms. Maloney of New York for her opening statement.
Thank you, Mr. Chairman, and welcome, Ms. Richards. Last week, the Democratic members of this committee sent a letter warning our chairman that the relentless campaign by the conservative House Freedom Caucus to attack Planned Parenthood was in fact part of a broader power struggle to unseat Speaker Boehner, led by an extreme wing of the Republican Party that is using this issue to force a government shutdown unless the Speaker bows to their demands. Our warnings prove prescient. On Friday, Speaker Boehner announced that he will resign at the end of next month, but not before creating a new select committee to investigate Planned Parenthood. Make no mistake, despite what we hear from the other side, Republicans are doubling down on their war against women. I request unanimous consent to place in the record this letter from the Republicans threatening to close down the government unless Planned Parenthood is defunded. And
Without objection, so order.
And when you read this, there are certain things that jump out. All of the signatories are men, none of whom will get pregnant or need a cervical screening for cancer or mammograms or a pap smear or other life-saving services that are provided by Planned Parenthood. We will hear today lots of arguments to justify the extreme actions of the Center for Medical Progress, those who created these videotapes. But there is one simple reason we are at this point. Republicans want to outlaw a woman's right to choose. Republicans say that this is all about videos purporting to show violations of our laws. But when the facts come out that contradict their narrative and it comes to light, it never seems to matter. For example, when we learned that the videos had dozens of unexplained edits, removing phrases like, quote, "We do not profit from tissue donation from those who work for Planned Parenthood," that did not matter. When we learned that less than 1% of Planned Parenthood centers had any involvement whatsoever in fetal tissue donation, that did not matter. When we learned that some Planned Parenthood centers involved in tissue donation took the extra precaution of accepting no reimbursement for their cost, far beyond what is even required by federal law, that did not matter. When we learned that Planned Parenthood centers that lawfully accepted reimbursement recouped only their costs and repeatedly refused offers from anti-abortion extremists to entrap them into accepting far larger amounts, even in one case 10 times more, Republicans still insisted they were trying to profit from these donations. The righteous rhetoric we've heard for weeks about Planned Parenthood trafficking in baby parts has one fundamental law. It is not true. And it never has been true. But it makes for a great soundbite. The reason the facts don't matter is that this whole episode is not about tissue donation or the Hyde Amendment or Medicaid reimbursement. The core issue is that Republican members of Congress now almost universally oppose a woman's right to choose. They oppose the constitutional right of abortion. An increasing number, like Senator Marco Rubio, support banning abortion with no exceptions, none whatsoever, not even in cases of rape, incest, or when the life of the mother is threatened. The majority of Americans disagree with these extreme views, and we will do everything we can to stop them. Because if we don't, there will be serious consequences for women across this country that rely on the services, life-saving services. It is their choice of over 2.7 million women to have their basic health care services provided by Planned Parenthood. In 103 counties with a Planned Parenthood Health Center, Planned Parenthood serves all of the women obtaining publicly supported contraceptive services. There aren't any community health centers that can step in to fill the void. If we don't continue this life-saving service, women will be denied health care across this great nation. This continued assault on constitutionally protected reproductive freedoms is based on outright falsehoods and lies backed up by fraudulent recordings selectively edited by radical anti-choice activists. And if they have their way, over 630,000 patients will lose access to birth control, STD screenings, and other reproductive health care, mammograms, cervical cancer screenings. We need to recognize this fight for what it is. It's about banning a woman's right to choose, and it is being driven by politicians, most of whom are men who think they have the right to dictate to women about their most private health care decisions. And I might add that Planned Parenthood polls 4 times stronger than Congress. And I might add that we should be investigating this group that did fraudulent, edited tapes, and not a distinguished health care providing, health life-saving group that is across this nation saving lives and providing basic reproductive health care to American women, many of whom are very poor and many of whom are very vulnerable. So I want to publicly thank Planned Parenthood. 1 in 5 women in America have gone to Planned Parenthood for services, including myself, at times in their life when they needed it. And I want to thank you for the work that you are doing to provide basic health care, reproductive health care services to American women and men.
I will hold the record open for 5 legislative days for any members who would like to submit a written statement. We've had wide interest from a number of our colleagues from broader House membership. I'd ask unanimous consent that the Congresswoman, Ms. McMorris Rogers of Washington, Congresswoman Sheila Jackson Lee of Texas, Congresswoman Black of Tennessee, and Congresswoman Love of Utah be allowed to fully participate in today's hearing. If there are additional Democrats that would like to participate, I'd be happy to waive them in as well to have an even balance. Without objection, so ordered. We'll now recognize our witness. Pleased to welcome Ms. Cecile Richards, President of Planned Parenthood Federation of America. Ms. Richards, pursuant to committee rules, all witnesses will be sworn in before they testify. If you will please rise and raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Thank you. Let the record reflect that the witness answered in the affirmative. And in order to allow time for discussion, we would appreciate if you would limit your testimony to 5 minutes, and obviously your entire written statement will be made part of the record. Ms. Richards, you're now recognized for 5 minutes.
Thank you, Mr. Chairman. I'm proud to be here today speaking on behalf of Planned Parenthood, a leading provider of high-quality reproductive health care in America. 1 in 5 women in this country has sought care from a Planned Parenthood health center. And they trust us because our rigorous health care standards have been developed with the nation's top medical experts over our 99-year history. There's been a great deal of misinformation circulated about Planned Parenthood recently, and I want to be absolutely clear at the outset. The federal funding that Planned Parenthood receives allows our doctors and clinicians at our health centers to provide birth control, cancer screenings, and testing and treatment for sexually transmitted infections. Now, while the federal policy, in my opinion, discriminates against low-income women, no federal funds pay for abortion services at Planned Parenthood or anywhere else, except in the very limited circumstances allowed by law. These are when the woman has been raped, has been the victim of incest, or when her life is endangered. Planned Parenthood operates just like all other health centers and hospitals that provide medical care to Medicaid patients. Medicaid reimburses us for the preventive health services that we provide, and the Department of Health and Human Services conducts routine audits of the Medicaid program to ensure that these funds are used appropriately. And the same is true for the Title X, the Federal Family Planning Program, which was signed into law by President Richard Nixon. Planned Parenthood has been in the news recently because of deceptively edited videos released by a group that is dedicated to making abortion illegal in this country. And this is just the most recent in a long line of discredited attacks, the 10th over the last 15 years. The latest smear campaign is based on efforts by our opponents to entrap our doctors and clinicians into breaking the law, and once again, our opponents failed. To set the record straight, I want to be clear on 4 matters. First, using fetal tissue in life-saving medical research is legal, according to the 1993 law passed by the Senate 93-4, and based on recommendations from a blue ribbon panel that was created under the Reagan administration. Second, Currently, less than 1% of Planned Parenthood health centers are actually facilitating the donation of tissue for fetal tissue research. Third, in those health centers, donating fetal tissue is something that many of our patients want to do and regularly request. And finally, Planned Parenthood policies not only comply with, but indeed go beyond the requirements of the law. The outrageous accusations leveled against Planned Parenthood based on heavily doctored videos are offensive and categorically untrue. I realize, though, that the facts have never gotten in the way of these campaigns to block women from health care they need and deserve. And Mr. Chairman, you and I do disagree about whether women should have access to safe and legal abortion. At Planned Parenthood, we believe that women should be able to make their own decisions about their pregnancies and their futures. And the majority of Americans agree. We trust women to make these decisions in consultation with their families, their doctors, and their faith, and not by Congress. It is unacceptable that in the 21st century, women in America are routinely harassed for accessing a legal medical procedure. Doctors who provide abortion, as well as their families, often face harassment and threats of violence, and after this recent smear campaign, it's only gotten worse. These acts against women and healthcare providers don't reflect American values or the rule of law, and I hope this committee will condemn them. For 99 years, Planned Parenthood has worked to improve the lives of women and families in America, and largely as a result of access to birth control, women are now nearly half the workforce in America and more than half of college students. And as a result of better sex education and more access to birth control, we are now at a 40-year low for teen pregnancy in the United States. But for all the progress we've made, there is much still to do. For many American women, Planned Parenthood is the only health care provider they will see this year. And it is impossible for our patients to understand why Congress is once again threatening their ability to go to the health care provider of their choice. 2 weeks ago, I was in Plano, Texas with one of these patients, Dana Ferris Fisher. And Dana can't be here today because she has a new job and she's supporting her family. But if she were here, Dana would tell you what she told me, that Planned Parenthood saved her life. In 2013, her husband lost his job and therefore their health insurance. And not long after, Dana found a lump in her breast. And the only 2 clinics that would take a patient without health insurance couldn't see her for at least 2 months. So Dana came to Planned Parenthood for a breast exam. And there, our clinician of 21 years, Vivian, guided her through the process of follow-ups and referrals and helped make sure that her treatment was covered. And she called Dana repeatedly to check on her as she entered treatment. And I am really happy to say today that Dana is now cancer-free. Mr. Chairman, I wish this Congress would spend more time hearing from women like Dana. All women in this country deserve to have the same opportunities as members of Congress and their families for high quality and timely health care. And so I want to thank you to be here today on the opportunity to testify on behalf of Dana and the 2.7 million patients who rely on Planned Parenthood for high quality, essential health care every year. Thank you.
Thank you. I'll now recognize myself for 5 minutes. Ms. Richards, Planned Parenthood has sent $32+ million in grants overseas. Does any of these funds go to the Democratic Republic of the Congo?
Congressman, let me tell you.
No. We don't have time for a big narrative.
I'm not going to give you you asked me a question. Any of the money that is Planned Parenthood raises and is given by foundations and individuals to support family planning services around the country is in Africa and in Latin America, and they go to individual organizations. I'm happy to provide you a list of those organizations, but I did not bring them with me here today.
You could give us a list of those organizations. Does Planned Parenthood have any ownership in foreign companies?
I don't believe so. I don't know what you mean by ownership.
Well, in your 2013 tax return, it lists $3.3 million marked as, quote, investment, end quote, in Central America and the Caribbean. I'm just asking if that investment was an actual investment.
We don't own anything in those countries. What our,
Okay,
our
let me
global,
keep going.
well,
I have to keep going. I need to I would appreciate a list, and you've been very cooperative so far.
we have
Give us
been
a list.
extremely cooperative.
Yeah, and I just cited that. If you can give us a listing, as you said you would, of where those dollars go overseas, we would very much appreciate it. Your compensation in 2009 was $353,000. Is that correct?
I don't have the figures with me, but I
It
don't
was.
want to.
Congratulations. In 2013, your compensation went up some $240,000. Your compensation we're showing in baseline tax returns is $590,000, correct?
That's not my annual compensation. My annual compensation is $520,000 a year. I believe there was a program that the board sort of put together for a 3-year. I'm happy, again, I think we've been extremely forthcoming with all of our documents.
Let me go to the next one.
Will the
Planned
gentleman
Parenthood-
yield?
No, I won't. The Planned Parenthood and its lobbying arm, Planned Parenthood Action Fund, it controls 2 527 organizations that have their own political activities, Planned Parenthood Votes and Planned Parenthood Action Fund PAC. Do they receive money from Planned Parenthood to conduct these activities?
The Planned Parenthood Action Fund is a totally separate corporation, receives no federal dollars whatsoever.
What about the management? Who manages it? Do you manage it?
It's managed by a team of people who are employed by the
one of
Planned
those
Parenthood
that helps
Action
manage
Fund.
it?
I don't directly manage it, no, sir.
Do you help manage it?
Some of my time is allocated to it, but I do not oversee the, I oversee.
In 2013, you were listed as a shared employee. In fact, you were compensated with $31,000 to help run that organization, correct?
You asked me, excuse me, sir, but you asked me if I ran the organization.
Or do you help run it?
Some of my time is allocated to the Planned Parenthood Action Fund, which is required by law, and we meet all of the legal requirements.
And so you also involved in the Planned Parenthood Action Fund. If you could help us understand what the duties are for your $31,000 of contribution, my guess is you running the mothership here, when you show up and want to have something done, it's probably done. Does Planned Parenthood control any organizations that lobby?
The Planned Parenthood Action Fund is a separate organization that has its own board and its own fundraising and no federal employees.
Shared list, shared emails, shared assets. This is the concern. Tell me about
I just want to make sure you understood my statement, since I know that we're talking about federal funds. 0 federal funds are related to the Planned Parenthood Action Fund.
It's the commingling that bothers us. Every dollar that you get, no, hold on. Every dollar that you get from federal dollars means you don't necessarily have to allocate it for these particular assets. So that's what we're concerned about. Tell me about the $200,000 you gave to the Ballot Initiative Strategy Center. What was that for? That was in 2013 as well.
So I'm not familiar with that exact payment, but I'm happy to
Well, you gave him $200,000. If you don't know, you're running this organization. Hold on. Let me list out what their goal is. Their mantra is, quote, envisioning a future where progressives change the game and use ballot measures as a political and civic engagement tool for victory. And you gave him $200,000.
Sir, I run an organization that has a budget of roughly $200 million. And so when you pull out one figure out of the last 5 years, I'm trying to be responsive. It's important to, and perhaps you're not aware that there have been many efforts in states over the last several years to pass ballot initiatives that restrict women's access to birth control and reproductive health care.
But you also
we've absolutely been involved in ballot initiative measures that have been introduced by people who want to restrict women's health care.
If you want to be a private entity, be a private entity, but you don't need federal dollars in order to do this.
I don't use federal dollars to do that, sir.
You do to run the organization. Planned Parenthood has given Planned Parenthood Action Fund more than $22 million to exercise to involve in their lobbying expenditures and their advocacy efforts.
None of the dollars that you are discussing are federal dollars, and the Planned Parenthood Federation of America receives almost no federal dollars. I think at this point only $21,000 for a clinical trial network.
It goes to the same organization, and you just separate all that out. Let me go to the last
point. We are highly accountable.
My time, I've gone over time. I need to show this last slide. This one I don't understand. And in the case of Dana, when she came to Planned Parenthood, did she get a mammogram?
No, she was referred for a mammogram. Absolutely.
And that's part of the challenge, is that you don't do mammograms. So if you,
We,
go ahead.
I'm sorry, I've
You
never...
don't do mammograms, correct? There's like 1 or 2 places that doesn't, but you don't do mammograms.
If you would give me one moment to explain. Planned Parenthood is a women's health center, just like where I go for my breast exams every year. If you need a mammogram, you're referred to a radiological center, and that's how women actually receive their care. And we provide breast exams I can get you the numbers of how many hundreds of thousands of women received breast exams at Planned Parenthood last year. Has nothing to do with, I don't, again,
Here's
you
the problem.
created this slide,
Leslie,
I have
I'm
no
trying to
idea
wrap
what
it
it
up.
is.
Well, it's the reduction over the course of years in pink. That's the reduction in the breast exams, and the red is the increase in the abortions. That's what's going on in your organization.
This is a slide that has never been shown to me before. I'm happy to look at it, but it absolutely does not reflect what's happening at Planned Parenthood.
You're going to deny that if we take
I'm
those
going to
numbers
deny
out
the
of your
slide that
report?
you've just shown me that no one has ever provided us before. We've provided you all the information about everything, all the services that Planned Parenthood provides, and it doesn't feel like we're trying to get to the truth here. You just showed me this. I'm happy to look at it.
I pulled those numbers directly out of your corporate reports.
Oh,
My
excuse
time
me,
is
my
expired.
loggers are informing me that the source of this is actually Americans United for Life, which is an anti-abortion group, so I would check your source.
Then we will get to the bottom of the truth of that. We will now recognize Mr. Cummings for a generous 7 minutes.
I thought it was 8, Mr. Chairman. I think it's 8.
Go ahead.
Thank you very much. Ms. Richards, I often hear women, including my wife, talk about the way women are treated as opposed to men. And not being a woman, I at the same time try to be sensitive. So I want to just the chairman just gave you a series of questions. I just have a few other ones. Ms. Richards, I find it extremely hypocritical that Republicans criticize the salaries of Planned Parenthood officials when you have violated no laws, especially while these same Republicans completely ignore the CEOs of huge companies that are actually guilty of breaking the law. Earlier this year, Citicorp, J.P. Morgan, and other major banks pled guilty to manipulating currency markets and interest rates. They were fined more than $5 billion for their actions. Yet Citigroup CEO still received $13 million last year, and J.P. Morgan CEO received $20 million. These banks get extensive federal support in the form of borrowing through the Federal Reserve's discount window and access to deposit insurance through the FDIC. Ms. Richards, do you know if House Republicans made any effort to strip the banks of their federal support that I just talked about?
I'm not aware.
Well, I can tell you they didn't. Johnson & Johnson, another one, was fined more than $2 billion for illegally marketing drugs and paying kickbacks to doctors and nursing homes. Yet the company's CEO still received $25 million last year. Ms. Richards, do you know if the House Republicans conducted an investigation of this company or other drug companies that violated the law? Do you?
I do not.
Well, I can answer that for you. No, they didn't. And they also never sought to deny them federal funding through Medicaid or to block their NIH grants. Let me go on. Last month, Lockheed Martin was fined millions of dollars for using taxpayer funds to lobby Congress to maintain its hold on a multi-billion-dollar Pentagon contract. Lockheed CEO received a stunning $33 million last year. Ms. Richards, do you know if there has been any investigation or any effort, to eliminate Lockheed Martin's federal funding?
Sounds like there hasn't been.
You got it. Of course there wasn't. These are huge companies that are actually guilty of breaking the law, and their CEOs make millions of dollars. Republicans never criticize the salaries of their CEOs, and they never try to strip their federal funding, their government subsidies, or their tax breaks. But when it comes to women's health, When it comes to women's health, the Republicans' approach is completely different. Republicans targeted Planned Parenthood, which provides essential, high-quality care to millions of American women more aggressively than all of these companies combined. With no evidence of wrongdoing, these Republican investigations multiply and the political theater continues. This whole defunding fight is just a pretext for the real Republican agenda. It's a pretext. Take away the constitutional right of women and their doctors to decide what is best for them. I reject these shameful attacks on women's health. Let me go on. Now, Ms. Richards, I want to thank you for being here. And Republicans accuse the Planned Parenthood of selling fetal tissue from abortions for profit. Federal law explicitly allows for the reimbursement of reasonable expenses for tissue samples. But the Republicans say that Mr. Dalyden's videos are proof that Planned Parenthood was making a profit. So at this time, I'd just like to, do you know who Dr. Deborah Nucatola is?
Yes, sir.
And who is that?
She works for us in our medical division.
I was going to show some clips, but our friends had some problems with it, so I want to just do some quotes from some of the stuff that Mr. Dalyden left on the cutting floor when he was doing his working with the tapes. Dr. Deborah Nucatola said, and I quote, "To them, this is not a service they should be making money for," end of quote. That was left on the floor. She said also, no, quote, "No one's going to see this as a money-making thing," end of quote. She went on to say, "We're not looking to make money from this. Our goal is to keep access available," end of quote. Another quote that was left on the cutting room floor, "We really just want it to be reasonable for the impact it has on the clinic. This is not something, this isn't a new revenue stream that affiliates are looking at. This is a way to offer patients a service that they want, do good for the medical community, and still maintain access at the end of the day," end of quote. She went on to say another piece on the cutting room floor, never, this is on the floor. Are there, quote, are there affiliates that would just donate the tissue or for free? Or, and then there's another one, and then I'll just end with this one. Dr. Nucatola said, and I quote, probably, I mean, really, the guidance is, this is not something you should be making an exorbitant amount of money on. So let me ask you this. Ms. Richards, I cannot imagine a more clear answer than these. I mean, as far as I can tell, Dr. Dalyden and his group spent the better part of 3 years, Ms. Richards, trying and failing to entrap Planned Parenthood employees. They tried to get someone to sign a contract, agree to a sale, or provide even one tissue sample at a price above the reasonable expenses that are allowed under the law. But nobody has identified a single incident where that occurred. Is that right, Ms. Richards?
That's correct.
It's amazing how hard Mr. Dalyden and his group tried to get your affiliates to accept more than reasonable expenses. Over and over again, they pressed, they pushed, they cajoled, but they never succeeded. So after they failed in this 3-year effort, when they were unable to get even one agreement, they put out these misleading videos instead, and they cut out every single time an employee said, no, 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 no. Ms. Richards, is my final question as I run out of time. In the clips that I just talked about, Dr. Nucatola was not aware that she was being secretly recorded. Do you know whether that's accurate or not?
That's completely accurate.
So she was sharing the truth. That is, Planned Parenthood does not seek to profit from its participation in fetal tissue research. Is that correct?
That's correct.
My time is up.
Thank the gentleman. We'll now recognize a gentlewoman from Wyoming, Ms. Lummis, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Richards, for being with us today. My first question is, how many Planned Parenthood clinics have mammogram machines?
There aren't any Planned Parenthood clinics, I believe, to the best of my knowledge, not any have mammogram machines at their facility.
And how many Planned Parenthood clinics are there?
On any given day, between 650 and 700.
Okay, so none, to your knowledge, have a mammogram machine.
Right, we have different kinds of arrangements with, depending on the state, to refer women for mammograms. As I said earlier to, I think, the question to the chairman.
And what surgical services does Planned Parenthood provide? Surgical services.
Well, we provide surgical abortions, and we provide colposcopy. We do a variety of services, and
Can you explain?
Ms. Loomis, to be responsive, you know, we have core services across the country, but some Planned Parenthoods provide broader services, some provide primary care, et
Okay,
cetera.
I was just asking about surgical services with that question. Tell me, so abortion is included in surgical services, but I want to find out where you get your 3% figure that you cite for abortion procedures. That's your self-reported abortion statistic.
That's 3% of all the procedures we provide and all the services that we provide.
Okay, well, let's talk about Planned Parenthood revenue from abortions. If you look at the 2013 statistics that you report, abortions from revenue would have been over 86% of your non-government revenue. How do you explain this massive disparity between the amount of revenue you collect from abortion and the fact that you only report 3% of your services being abortion?
Well, I think there's two questions you've sort of mixed in there, so let me try to address both. One is, as we've already stated, federal money does not go for abortion, so the federal portion that we were discussing is reimbursement for preventive care services. I think the other, so that's why they're not, those numbers aren't connected.
Can you tell me how many of your affiliates receive the majority of their revenue from abortion?
I don't know that answer.
Could you get it for me?
I'll talk to my team.
Thanks.
But I do think it's important to understand that abortion procedures are probably more expensive than some other procedures that we provide, which might explain what you're trying to get at.
Okay. According to your 2013 tax return, I'm switching now to travel expenses. Planned Parenthood spent over $5.1 million on travel last year. So as the chairman said earlier, that's nearly $14,000 per day. What is all that money being spent on?
Well, we're an organization that we're in 50 states. We also, as the chairman has noted, we have programs in Latin America and in Africa as well, where we support family planning programs and those. So I can certainly, and I think we have provided very detailed information, thousands of pages of both our financial statements, our audited financials, our annual report, and if there's anything that we need to break down further, I'm happy to do that. What I would say that, again,
I would very much appreciate it if you would break it down, because the taxpayers are funding over 40% of Planned Parenthood. And my point is, they just have a right to know how this money is being spent.
Absolutely.
And if taxpayer dollars are being used to free up services that you provide that are aberrant services in the view of many taxpayers, when there are alternatives in this country, many, 13,000 clinics that cater specifically to women's health.
Well, Congresswoman Loomis, I'd like to address that, because one of the comments that was made earlier and I wasn't able to respond is that we don't get a federal subsidy. Really, it's important to understand for everyone here how the Medicaid program.
Could you function on non-federal dollars? Why do you need federal dollars? You're making a ton of dough.
We don't make any profit off of federal money, and if I could just have a moment to explain.
But you're using federal
1.6
dollars
million.
and displacing money that could go to the 13,000 healthcare clinics. My time's up. I yield back.
Want
Could I
to-
answer the
Sure,
question?
sure.
I'm not sure exactly what the whole question was, but I do think it's really important that you understand that 60% of our patients are receiving they're either Medicaid patients or they may be Title X patients. 78% of our patients live at 150% of poverty or below, and for many of them, Planned Parenthood is the only family planning provider that will see them in their area. Half of our health centers are in medically underserved communities. So it is not we don't just get a big check from the federal government. We, like other Medicaid providers, we are reimbursed directly for services provided.
Mr. Chairman, thank you for allowing Ms. Richards to answer the question.
Thank you. And just as a point of clarification, Ms. Richards, I want to make sure there's no ambiguity here. The gentlewoman from Wyoming asked for a listing of affiliates where the majority of revenue comes from abortion services. You said you'd talk to your team. Will you actually provide us that list?
I will talk to my team. Just for the record, I'm here voluntarily. We have provided tens of thousands of pages of documents to you. We've provided audited financial statements. I will talk to my team and we will do everything we can to be.
For the record, you have been very cooperative. I just want to keep that rolling. And you were very good at agreeing to give other bits of information. Why not this part of information?
I don't want to commit to anything that I don't
Why not?
personally have. I said I will work with you and your team. We have no interest in hiding any information.
If you have it, will you give it to us? If you have it, will you give it to us?
I don't have it, so I'm just saying to you, I will work with my team, and we're working with your staff to provide any and all information that we can.
I would hope that that would include the request from Ms. Lummis of Wyoming as well. I now recognize the gentlewoman from New York, Ms. Maloney, for 5 minutes.
Thank you, Mr. Chairman, and I first would like to register my opposition and my objection to the chairman beating up on a woman, on our witness today, for making a good salary. In the entire time I've been in Congress, I've never seen a witness beaten up and questioned about their salary. Ms. Richards heads a distinguished organization providing health care services to millions of Americans, and I find it totally inappropriate and discriminatory. Ms. Richards, are you aware that there are over 285 rallies in support of Planned Parenthood, including one in my district today, and that many are calling today National Pink Out Day in support of the services and life-changing and life support services of Planned Parenthood? Are you aware of that?
I am aware of that, and I look forward to changing into pink as soon as these proceedings are finished today.
And are you aware that over 2.7 million men and women in America choose Planned Parenthood as their primary health provider, and that there are 2 Planned Parenthood clinics in the district that I am privileged to represent, and if you go at the end of the day, young women and men are lined up through the waiting room, out the door, and on some days clear down the block waiting for the health care services of Planned Parenthood.
I'm glad to hear that, and again, we're pleased to provide services to anyone who walks in our door. One of the things that I think is very important and refers a little bit to the question earlier is that 60% of our health centers are able to see patients on the same day. And I know for many women, if they are concerned about a lump in their breast or they need birth control, and for some of them they haven't had an annual exam in many, many years, we're proud to be able to serve them with high quality care when they need it.
And are you aware that this hearing today is promoted by a series of deceptively edited and purposefully misleading videos that have been found to be deceptively edited by leading fact-checking organizations in this country, including 5 states. 5 states had their own individual investigations. Now it's 6. Missouri did their own review, and they found that they are complying, that Planned Parenthood is complying with all state laws and regulations regarding tissue donations. Now, are you aware of any other efforts by Republicans and others to defund other organizations that provide health care, reproductive health care to women in this country?
I'm not aware of any, but there may be.
What about attacks on Title X?
Well, I think it has been concerning that not only are we seeing in this country efforts to end access to safe and legal abortion, which is an important right of women in America, but the reductions in support for family planning are equally disturbing. I'm very encouraged, actually, that finally we're beginning to see some breakthrough. As I said earlier, we have now the lowest teen pregnancy in 40 years in America. We're seeing much better birth control, and through the Affordable Care Act, now 50 million women getting access to no-cost birth control. I think there is a lot we can do to reduce unintended pregnancy in America.
Well, what do you say to those who want to defund Planned Parenthood and outlaw abortion altogether in our country?
Well, I think what's important to me is, you know, at Planned Parenthood, we trust women to be able to make their own health care decisions and to make their decisions about where they want to go to for health care. And I know that a lot of the members of this committee feel strongly that people should be able to go to their own doctor. So this isn't really an attack on Planned Parenthood. This is an attack on 2.7 million patients who each year choose Planned Parenthood as their health care provider. And I think they should have that right.
And I agree with you completely. We in Congress can choose our health care provider. Vulnerable men and women should likewise be able to choose their health care provider. I would just like to end by saying that using these videos to justify efforts to defund Planned Parenthood is an extreme abuse. It is deceitful, and it undermines the integrity of this committee. Thank you. My time has expired.
Gentlewoman's time has expired. Now recognize the gentleman from Ohio, Mr. Jordan.
Thank you, Mr. Chairman. Ms. Richards, if the videos were selectively edited, heavily edited, if this was entrapment, if this was all untrue, then why'd you apologize?
Well, Congressman, first, I think everyone has agreed they were heavily edited, and that certainly I think even the perpetrator.
My question is, why'd you apologize?
Perpetrator has agreed they were done undercover. I spoke with Dr. Nucatola, who was featured in one of the videos, and I thought it was important, in my opinion, it was inappropriate to have a clinical discussion of in a non-confidential, non-clinical setting, and I told her that.
What were you apologizing for?
That she used, I think, in my judgment, it was bad judgment to have a clinical discussion in a non-clinical setting, and that's.
I mean, the first video comes out July 14th. 2 days later, you go and issue an apology, and you said this: "It's unacceptable. I personally apologize for the tone and statements."
Well,
so
and
I
that's
want to
what
know.
I felt like.
No. Here's the question: Which statements were you apologizing for?
It was really the situation that she was in, and I believe that.
That's
and
not
again,
what,
at that.
But Ms. Richards, that's not what you said. You said, "I apologize for statements." I'd like to know. I think the American people like to know which statements in the video were you apologizing for? Were you apologizing for statements that were untrue? Because you normally don't do that in life. If something's untrue and false, you don't apologize for that. You correct the record. But that's not what you said. You said, "I personally apologize for the tone and statements," and I'm asking you a simple question. There was only one video at the time you issued this statement. When you did your video, there was only one video. I want to know, in that video that you were referencing, which statements were you apologizing for?
Well, Congressman, at the time, as you, I'm sure, remember, that video was released. We'd had no time to actually evaluate how much editing had happened. It was days later that we were able.
Which true statements in that video were you apologizing for, Ms. Richards?
I was reflecting that on that video, not any particular statement, that given they did not reflect the compassionate care that we provide at Planned Parenthood.
That raises an important question. So is what you said in your video untrue? You weren't really apologizing for statements made?
I was apologizing for what was said in a non-clinical setting, in a non-appropriate way, and I don't believe,
You can't have it both ways. You can't say, I'm apologizing for statements in one video and then not tell us what those statements were.
I don't believe that Dr. Nucatola.
Or you can do this. You can say, you know what I said in the video I produced wasn't true. I really wasn't apologizing for any statement. You can tell us that here on the record if you'd like, but it can't be both positions. It has to be one. And I want to know which one is it. And frankly, the American people want to know which one is it.
In my judgment, it was inappropriate to have that conversation in a non-clinical setting, in a non-confidential area about clinical matters.
Okay.
And I've told that to Dr. Nucatola.
Why didn't you, okay.
I will also tell you,
Why didn't you say
Dr.
that?
Nucatola.
Why didn't you say that? This wasn't a reporter sticking a mic in front of your face. This was a video you produced to send out to the whole world.
We may just, Congressman, we may just have to agree to disagree.
Why didn't you say that?
We may just have to agree to disagree on this matter.
I don't think we're agreeing to disagree. I think you're not answering my question.
Well, I've answered it, I think, repeatedly here. And I want to say also for the record
Mr. Chairman,
that Dr.
real quickly, just for the record, but this to me is critical, because at the moment you did this, there was only one video. And then you do your video in response to that video, and you made a specific statement. I'm sure your staff worked on this, you prepared this. This probably went through a number of drafts, and you were very specific in what you said. I apologize for the tone and statements. So there's obviously statements in that first video that were accurate, that you didn't think were needed to be out there, and you wanted to apologize for it, and you wanted that message heard by the American people. And I'm asking you a simple question.
Okay,
in that first video, tell me what you needed to apologize for.
That highly edited video that now, of course, as we have gotten further, and I've read
that
pages
highly edited video that you apologize for.
Pages now, I have now read hundreds of pages of all of the things that were said, and what is clear now, that there were many, I think 10 times during that conversation in which Dr. Nucatola expressly
it's
said,
a simple question.
Well, I've answered it.
It is as simple and as basic as it gets. You don't apologize for things that are inaccurate. You apologize for things that are accurate. And you said there were statements in that first video that I want to apologize for. I'm asking you to tell this committee chairman, this committee, and the American people, what were those statements?
Well, I think I've already made my explanation, and just for the record, Dr. Nucatola is an excellent doctor.
I'm not saying she's not. I'm asking what you said.
Well, I just like, but
Gentleman's time.
you've had your moment. I wanted to make sure that you understood that she provides incredibly compassionate care, and I'm proud of her.
Thank you. We now recognize the gentlewoman from the District of Columbia, Ms. Norton.
First, I want to thank you for the Medicaid funds you do receive. The fact that they are Medicaid funds makes its own statement about who you are serving. You are serving low-income women in my community and throughout the country. I want to thank you for that. I want to congratulate you on raising your own funds. You receive a very small grant. You are being investigated by 4 committees of the United States Congress, and the Speaker wants a standing committee. None of them have indicated they want to investigate this deceptive tape, which at the moment is enjoined because it may indeed be illegal. Yet this committee is about uncovering illegal matters, not providing a cover for such matters. You know, when I saw this tape, I had a sense of deja vu. And I asked the staff to look to see, you know, isn't there some kind of pattern here? And discovered that there were nearly 10 of these deceptive sting operations over the past 10 or 15 years.
Correct.
May I ask you, has any one of those stings uncovered wrongdoing on the part of Planned Parenthood?
Absolutely not, and thank you, Congresswoman Norton. I think it's important to recognize this is a tactic that's been used repeatedly, as you say, 10 times over the last 15 years, and every single time has been thoroughly discredited.
You know, and it seems they never learn, Ms. Richards. I want to bring to your attention a sting from 2000 that looks remarkably like this one. An anti-abortion extremist approached a committee, I think it was the House Energy and Commerce Committee, to say they had evidence that Planned Parenthood was selling fetal tissue for profit, which is, of course, what has been alleged by Republicans consistently. Of course, there was an investigation, the hearing with this whistleblower who claimed he had helped Planned Parenthood sell fetal tissue for profit, and that he had seen intact fetuses at a Planned Parenthood clinic. By the way, does that not sound familiar? He said there was an affidavit at the hearing. He swore in his affidavit, this is somebody who was watching out for perhaps being prosecuted, at the hearing, that he had no personal knowledge of anyone at Planned Parenthood selling fetal tissue for profit. During his testimony, this is about 15 years ago, he admitted that he was paid by an anti-abortion group to appear in the sting video. And I want to quote what he said. "When I was under oath, I told the truth. Anything I said on the video when I was not under oath, that is a different story." Does that not sound like the story of this video?
I think it does.
I want to know how you can protect yourself as an institutional matter. How do you deal with these repeated stings, unsuccessful though they are, being approached year after year as you attempt to provide health services for low-income women? What do you do as an institutional matter with repeated stings to keep going in the face of this activity?
Well, I think what keeps us going, and I think I could speak here for the thousands of folks that work at Planned Parenthood, many of whom deal with threats and to their own personal safety, is it's the patients. That's what keeps you going.
But is there anything you can do to protect yourself? Excuse me, to protect yourselves when people come off the street? You presume they would be in good faith. Is there anything that an organization could even do to protect themselves against unethical activity of this kind?
Well, we work very hard to protect our patients, and they're our number one priority always. And so we have security. We take it very, very seriously. It's a shame to think that there are people in this country who are so committed to ending women's access to both birth control and safe and legal abortion that they'll really resort to any means to try to entrap people, twist the truth in order to reach their ends. But again, we believe, and why I'm here voluntarily today, is that the facts are on our side. We're proud of the health care that we deliver every single year, despite the animosity by some, and we're grateful that the American people stands with Planned Parenthood, as I think the Wall Street Journal poll showed last night.
65%.
Thank you, Congressman.
Thank the gentlewoman. We'll now recognize the gentleman from Florida, Mr. Micah, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Richards, for being with us. I guess we're all products of our personal experience. We heard the chairman, we heard the ranking member, how their lives are affected. I guess when I was young, I had a different opinion, but when my wife and I lost our first child, your life and your philosophy change. And from that time, I tried to be a champion for the unborn. They don't have advocates. A lot of groups that get a lot of money advocating, but they don't have a very good lobby. you are an advocate for abortion, and your organization provides a significant number of abortions. I think the staff told me there are about 300,000 abortions last year in the United States. Is that approximate?
About 300,000 at Planned Parenthood.
At Planned Parenthood?
That's correct, sir.
What's the total in the United States?
I think it's about 1 million. I actually, don't hold me to that, though. I don't have the numbers in front of me.
So basically, you provide about a third of the abortion. So you're the leader. You would probably have to be the leading provider of abortion in the country, your organization.
I don't know if that's exactly true. I just can only know what we do.
And, I've had belief of some exceptions, but there are many people that I represent myself who object to any public money going into abortions. I think the majority of Americans would oppose public federal dollars going into abortion. Would you agree with that?
I don't think the polling reflects that, but I guess, and it depends. I'm not familiar with your district.
But again, I think you ask people, I think they would, and that's part of it. Now, your most recent controversy raised questions about public money in your organization. I looked at it. I was kind of stunned. It's about 41% of your total money is federal money. That's not just a small amount, because if you add your the money you get from different programs, grants, et cetera, it's 41%, and I've had that figure confirmed. That's a significant amount of money. Nobody, I don't think most people have any problem with you spending the money on women's health care. I'm a strong advocate for that. You have 650 clinics.
Roughly, there are new ones opening all the time.
You told Ms. Loomis that you don't have one mammogram machine in one.
Mammograms have never.
So you don't do that, but
we do breast exams,
you do.
Just like my own doctor does for.
But
right.
Your breast exams actually are down significantly, and I've got the numbers from your reports from 830,312 exams in 2009 to 487,29 in 2013, and those are your statistics.
Okay.
So you're getting more money. You're not spending it there. Now, do all 650 of the clinics perform abortions? Or
no, sir.
How many?
Roughly half provide abortion services.
So half of the clinics. Again, this is where when 41% of the money is coming out of the public treasury, people become concerned. And there are people who, their religion, their principles, they feel very strongly, as do I, that no public money should go into this. Mr. Cummings said we should do everything we should to put money into research. You're not putting money into research. You were criticized for your salary, which is, it's a big organization. But then you look at where's the money going? In Minnesota, North Dakota, South Dakota, one employee got $459,000. In southern New England, one employee got nearly $400,000, $398,000. Another one in Monte, $387,000. Another one, $377,000. Another one, $250,000. There are dozens of employees with over a quarter of a million dollar range. People want the money to go for research. People want the money to go for helping women with their health care, identifying the problem, or putting the money where it can do the most good. Mm-hmm. And again, we have at least the perception of it not being the case, and the chairman outlined travel, lavish parties and expenses. And maybe you separate that money out, but I'm telling you, it does not look good. I yield back.
Thank the
I would love that chance to respond, but I guess that wasn't really.
It was more of a comment than a question. We need to keep the pace here.
Okay.
We'll now recognize the gentleman from Virginia, Mr. Conley, for 5 minutes.
I thank the chair. Welcome, Ms. Richards.
Thank you, Congressman.
Wish your mom were here today. She'd be handing out Texas boots to a lot of my colleagues.
She's here in spirit.
Yep. Thank God. I hope every American woman is watching today's hearing, because just the visuals, as well as the audios, tell you a lot. My colleagues like to say, there's no war on women. Look at how you've been treated as a witness. Intimidation, talking over, interrupting, cutting off sentences, criticizing you because of your salary. How dare you? Who do you think you are? Making a professional salary as the head of a premier national organization and daring to actually make decisions as the head of that organization. Lord Almighty, what's America coming to? The disrespect, the misogyny, rampant here today, tells us what is really going on here. This isn't about some bogus video, the author of whom does not have the courage to appear here, nor would the majority call him, because they know he'll make a bad witness under oath. This is about a conservative philosophy that says we are constitutionalists. They hold it up. We believe in rugged individualism and personal liberty, with one big carve-out, though. There's an asterisk in that assertion. And that is, except when it comes to women controlling their own bodies and making their own health decisions. You would never know that the Constitution, according to the Supreme Court, guarantees a right of choice. Hopefully, apparently, we're going to erode that choice and that right by using insinuation and slander and half-truths to besmirch a premier organization whose primary mission is to provide health services both to men and women, but primarily women. You know, this notion, one of my colleagues said, well, getting rid of Planned Parenthood, we'll just hand over these functions to community health clinics and other nonprofits that can take up the slack. Now, if you were really committed to that principle, surely you would agree to the expansion of Medicaid as provided under the Affordable Care Act to, in my home state of Virginia, 400,000 people who aren't currently covered.
That's correct.
Make your job a lot easier, wouldn't it?
A lot of women, a lot of families in this country need access to health care that aren't
Right.
getting it.
So if we really mean it, that's what we do. But of course, the very same people who are saying that vehemently oppose the expansion of Medicaid, which would be funded in the first 3 years by 100% of federal dollars and thereafter 90%, a good deal for any state, which might be why the governor of Ohio, the Republican governor of Ohio, actually agreed with that and expanded it.
That's right.
Is there anything else you want to add, uninterrupted, with some sense of respect, Ms. Richards? Let me at least provide that to you.
Well, thank you, Congressman. And I did want to respond to some of what's been said. We are a healthcare provider to 2.7 million people every year. They come to us by choice. And so when I think about what's really at stake here, particularly for folks who think about ending access to Planned Parenthood, I think about those folks. Last year, we provided 3.5 million birth control services in this country, 4.4 million STD testing and treatments, 378,000 Pap tests, and almost 500,000 breast exams, and more than 1 million pregnancy tests. I think it's interesting, one of the things we do at Planned Parenthood is we work to the highest level, most current level of health care for women. And so it's interesting, we're being criticized for the decline in Pap smears, but in fact, that's because we actually have adopted the recent, the best medicine, which is that not every woman needs a Pap smear every year. To me, that's what we're about, is making sure that every woman in this country, regardless of where she lives, regardless of her income, her immigration status, whether she's insured, can get access to health care. That's what we do at Planned Parenthood, and we're proud to do it.
And there's one
Thank the
other
gen-
thing,
Thank the gentleman.
and that's
Gentleman's
called
time.
respect. Thank you, Ms. Richards, for being here.
Thank you.
Thank the gentleman. Now recognize the gentleman from Tennessee, Mr. Duncan, for 5 minutes.
Ms. Richards, this is my 27th year in Congress. I can assure you I've seen many male witnesses treated much tougher than you've been treated here today. And also, surely you don't expect us, I can assure you I'm not going to be tough on you, but surely you don't expect us to be easier on you because you're a woman.
Absolutely not. That's not how my mama raised me.
Right. All right, let me ask you this. You say in your testimony that a lot of women wouldn't have access to certain types of health care were it not for Planned Parenthood. Do you know that the Department of Health and Human Services says there are 9,727 health care service delivery sites. There are 4,082 rural health clinics, 1,200 federally funded qualified health centers that also operate 9,000 other sites, over 9,000. You know about that? And you also know that there are over 2,000 pregnancy health centers, over 80% of which receive no federal funds at all. And that doesn't even count many hundreds of thousands of private doctors, nurses, and healthcare delivery services, walk-in clinics, and so forth. Have you taken all that into consideration?
What I certainly, and I mean, what I can speak to is what I know about is the patients that choose, again, voluntarily to come to us. I think one of the interesting things is that for nationally, a third of the women who access family planning services through a safety net provider, a third of the women get that from Planned Parenthood, even though.
But my point is there are
many
many thousands of other alternative health care providers. Let me ask you this. According to our reports, there are 2.3 million private charitable organizations, almost all of whom receive no federal funds, but do you know how many receive 41% of their funding from the taxpayers?
I don't know how many see as many patients as we do. We see 2.7 million patients a year.
Do you know of any other private charitable organizations that are receiving 41% from the government or 528 million from the taxpayers?
Well, again, I think the fair comparison would be who's seeing 2.7 million patients, because as I said earlier, we don't get a big check from the federal government. We actually are reimbursed for services delivered, for birth control, for STD testing and treatment, for well women visits.
Well, I can tell you that almost every one of those 2.3 million charitable organizations would, I'm sure, if given the opportunity, would tell us that the government or taxpayers benefit from what they're doing also. And just to give you an example, the National Boys and Girls Club in their clubs in their last annual report said they received $26 million from the federal government compared to your $528 million. It seems a little bit lopsided to me.
The cost of providing health care to 2.7 million people, and I very much respect the Boys and Girls Club, but we are actually we work like hospitals and other health care providers and being reimbursed directly for services that we provide. Again, I think the comparison is a little apples and oranges.
Let me ask you this. Do you think it's right in a free country to force people to contribute to your organization, because that's what you're doing, taking taxpayer money from people that are totally opposed to what you're doing?
We provide health care under the Medicaid program, just like every other hospital and health care provider that sees Medicaid patients. And I think one of the things that's important to understand is in many areas, there aren't new doctors or healthcare providers that will see Medicaid patients. And particularly when you're talking about OBGYN services, it's not always easy for women, and particularly in the southern United States, to find someone who will actually provide them a well woman visit, birth control services.
Let me ask you this, because my time's running out, but I know you apologize for the discussion and the tone and maybe the laughter. I don't know whether you apologize for the laughter or not on the videos, but do you, I'm not clear on this, do you defend the sale of baby body parts?
No. And I think that is really a total mischaracterization. Fetal tissue research, which, as I mentioned, was started, the whole commission that legalized and created the structure under fetal tissue research was started under the Reagan administration. And it is actually, what it does is facilitates fetal tissue donation. And that is actually, and as I said, fewer than 1% of our health centers do facilitate fetal tissue donation for the patient, but fetal tissue research has...
My time has run out. I just want to say this. It seems to me that the apology you offered was like what some criminals do. They're not really sorry for what they've done. They're sorry they got caught. And it seems to me that your apology is more because you got caught on these videos. Thank you, Mr. Chairman.
I respectfully disagree.
I thank the gentleman. The gentlelady from Illinois, Ms. Duckworth, is recognized.
Thank you, Mr. Chairman. Ms. Richards, thank you for being here and testifying today. I'm troubled by the ongoing attacks to defund Planned Parenthood, an organization that provides such extensive preventative health care services to millions of women. And in fact, I ask unanimous consent to submit for the record a letter from 92 organizations that work closely with Planned Parenthood, talking about all of the great high-quality health care Planned Parenthood provides to women and men across the country.
Without objection, so ordered.
Thank you. I myself have received services from Planned Parenthood. In fact, I, like many young men and women in this country, when I was in my early 20s and first in college, I came from a very poor family. And I wasn't really able to afford college. And in fact, I went to college based on student loans and Pell Grants and 2 jobs, one of which was as a waitress. I couldn't get that waitressing job without getting a health exam. And I couldn't afford to go to a doctor, and the job was there. You can start Friday if you come in with a valid health exam. Go to your local Planned Parenthood. They'll do it for you today, and you can start work in 2 days. It was a lifesaver. And so I remember what it was like to be a young person needing the health care and being able to trust that I could go to my local Planned Parenthood to get all the care that I needed. So thank you to the organization for providing those services for me when I was in need. I want to talk a little bit about what you do across the country and focus a little bit as an example on my home state of Illinois. I think it's a critical point that 96% of the services at Planned Parenthood, according to your most recent annual report, are for preventative and screening services. In fact, in Illinois for 2015, and I think, tell me if these numbers sound accurate to you, nearly 60,000 patients were served over the course of approximately 110,000 visits in Illinois. Nearly 50,000 visits were for contraceptive services, and over 34,000 visits were for STDs testing and treatment. 7,000 visits were for cancer screenings. Does that sound about right to you, Ms. Richards?
That does. Thank you. Yes, Congressman.
Thank you. I would like to address an issue that started very early on in this hearing, which was this implication that by allowing Medicare and Medicaid to reimburse Planned Parenthood, we are shifting money away that could be better used for military defense and for our servicemen and women. And as a military woman who just retired after 23 years of service, I'd like to ask you to talk a little bit about the services that Planned Parenthood has provided to military men and women and their families for the past several decades, and also include the women of the Peace Corps. I think that it is especially important to note that the very women who are willing to lay down their lives to defend the Constitution of this great nation were denied services under the Hyde Amendment for abortion services, especially as a result of rape or incest. And especially, this is tragic in light of the many tens of thousands of women who are victims of military sexual trauma every single year. So could you go over what you have done for military men and women and Peace Corps volunteers for the past many decades?
Well, thank you, and I'm glad we were able to provide you health care when you needed it. I know for many young women, I too, my first real doctor visit was at a Planned Parenthood when I'd gone away from Texas. So I'm grateful as well to the organization. We do serve everyone, and that is really our mantra is care no matter what. We believe it's so important that no matter what walk of life someone comes from, whether they're insured, whether they're in the military, that they get services. In fact, I remember the last time that this House of Representatives went through a similar exercise. I remember hearing from a woman in North Carolina who said, she wrote in, she said, I don't know if they know that us military wives go to Planned Parenthood when the doctor on base can't see us. And so I do know that we serve military families all over this country, and we're proud to do so.
Can you talk a little bit about Senator Murray's bipartisan legislation to allow Women, Veterans, and Families Health Services Act which would allow us access to IVF treatment, many of us for infertility issues caused by a military service, being withdrawn as a result of the attacks on Planned Parenthood?
Well, I'm not familiar with all the details of her bill, but I know Senator Murray has been a strong advocate for ensuring that women in the military get the same types of services that women do here in the States. And I think we are highly supportive of that. It's incredibly important to me that we equalize women's access to health care, both globally and in the U.S.
Thank you very much, Ms. Richards. I yield back, Mr. Chairman.
Thank the gentlewoman. We'll now recognize the gentleman from Michigan, Mr. Wahlberg, for 5 minutes.
I thank the chairman and I thank the witness for being here, and I want you to note I'm wearing a pink tie in solidarity with women's health issues today. My wife, my daughter-in-law, my daughter, my 2 granddaughters
Congratulations.
are extremely important to me. Just to go back to some of the statements on the video, I think videos, and I'm not going to spend time there, but Planned Parenthood commissioned a report by Fusion GPS examining the authenticity of the videos. The conclusion of that report says the analysis did not reveal widespread evidence of, quote, substantive video manipulation, and it, quote, shows no evidence of audio manipulation. Full versions of the videos are available on the Center for Medical Progress website and the CMP YouTube channel, showing that the only parts that have been edited are 1, bathroom breaks, and 2 breaks where no conversations took place. I just want that stated for the record, Mr. Chairman, as we have a lot of controversy about the videos, and yet the eyes show, but the ears even more so hear what was said. Let me go
Could I address
very quickly,
Yes,
because I want to go on
I
to
understand
more
it.
crucial issues.
Well, I do think it's important that that we at Planned Parenthood asked, I think even perhaps prior to this committee, that all the original source footage be released. And that has still not happened because, again, we want to know, we want all of it out there.
Well, we want to know too, and I think that will be an opportunity.
We can agree on that.
What we've seen so far, the ears have heard what was said. Also, I would address the unnecessary attacks coming from some of the other side, especially on men taking an interest in the lives of people most important in our lives. If men in this society aren't allowed to stand to defend the women and children we love, what does our country fall into? It's a shame we're even having this type of hearing today when we've been brought into a frenzy and a concern about what happens to our babies, our most defenseless. I just held in my arms my brand new granddaughter 3 weeks ago in an African country where she was born. I thank God for that life, that unique, special life. And I told my son-in-law on the way home, I said, it's amazing, Prince, that as we drive home here today, having never met this little girl before, I would give my life for her. I love her. She's unique and special. That's why we have this hearing today. We want to get to the truth. We want to make sure women's health care issues are dealt with and dealt with appropriately. In that same country, meeting with the president of the country next day and the Speaker of Parliament, who's a female, they pleaded with me as a member of Congress to stop hurting their women and families and children trying to change their culture with organizations like our State Department, USAID, and Planned Parenthood. Let me ask some questions here. And I take this information from Planned Parenthood Federation of America, your website, and I take it from Medicare Benefit Policy Manual. It says that both federally qualified health care centers, 13,000 of them in this listing, and Planned Parenthood centers provide pelvic exams, Pap HPV testing, STD testing, manual breast exams, birth control. Both entities provide that. Is that correct?
I don't know the entirety of what all FQHCs provide, but I know that we provide all of those.
But you provide all that I just mentioned.
Yes.
But emergency first responder care, mammograms, immunizations, diabetes and glaucoma screenings, cholesterol screenings, pediatric eye, ear, dental screenings, well child services, radiological services, cardiovascular blood tests, bone mass measurement, nurse on staff, all of those, according to your website, you don't provide.
We provide in some places, but it's not a core service, so it depends on the
It's
state.
not a promised service.
It depends on the state.
According to the Medicare Benefit Policy Manual, the federally qualified health care centers provide those services. Now, if we're talking about care for women, I would suggest that the care is there in 13,000 without the controversy of the abortions, the fetal manipulation, and potential use of body parts in the wrong way. And I think for the record, if we're talking about women's health care, the issue of where we find it is found in 13,000 plus centers available to women, and Medicaid isn't dealing with it. And, oh, by the way, your opening statement indicated great problems with Medicaid, and Obamacare is supposed to take care of that. I hear my time has ended, and thank you, Mr. Chairman.
I'd be happy to.
Gentleman yields back. Now recognize the gentlewoman from Michigan, Ms. Lawrence, for 5 minutes.
Thank you. There's a couple of things. It's very troubling to sit here as a woman and to hear some questions that obviously are insensitive. One, the continual question of why don't you provide the x-rays for a mammogram, where every woman here knows you have a primary doctor, and that doctor examines you, and if there is a lump, you are referred to a specialist. So I wish those who would sit here to ask those questions would actually have the sensitivity to understand what a woman goes through with her health care. That would allow us to ask more pertinent questions. Secondly, it is exhausting to keep hearing about federal dollars being spent on abortion when repeatedly the facts state, and it's not a controversy, read the facts, do your research before you ask these exhausting, sometimes I feel insulting questions. We cannot use federal dollars for abortion. This is not a lump sum budget item that we give to Planned Parenthood. It is reimbursement. How many times does that have to be repeated for this to become an embraced fact? If there were no citizens of the United States going to Planned Parenthood to receive these medical approved services that we approve as a Congress, there would be no reimbursement going to Planned Parenthood. They would not receive any funds. I just, for the life of me, sitting here today, I know my colleagues are more intelligent than this, and it is exhausting to hear just a philosophy of attack to just use information that is totally incorrect, as if I keep saying it some kind of way, it'll become factual. My question, Ms. Richards, there seems to be this continuous thought that if Planned Parenthood went away, that there would be these other health care services for a million of women because you went away. There's a suggestion that all of these community health centers would just step in and fill up. Sarah Rosenbaum, a professor of health and law and policy at George Washington, has worked with the community health centers for years. And I quote, "A claim that community health centers readily can absorb the loss of Planned Parenthood is a gross misrepresentation." I would ask you, Ms. Richards, in your experience in healthcare, the perception that if you went away, it would be totally absorbed, can you please respond to that?
Thanks, Congresswoman. Yes, I think this is a really important point, and I know there's been a lot of discussion. First, just for the record, we see 2.7 million patients a year. 78% of them are at 150% of poverty or below. So these are a group of women and men and young people who are often uninsured and certainly have less access to care. I know there have been a lot of reports that have come out since Congress has suggested eliminating access to Planned Parenthood for patients. I know the CBO own study, the Congressional Budget Office, estimated that 390,000 women would lose care next year if Planned Parenthood, if women could no longer go to Planned Parenthood. And I think to some of the questions that have been raised, it's really important for folks to understand, just as you talked about how women actually get breast exams and breast care in this country. In some areas, we are the only safety net family planning provider. And that is the care for most women, and particularly young women, what the care that they need is family planning, it's access to their cancer screenings and their well-woman visits. For many, in many areas, there are long waits. We're 60% of our clinics will see folks the same day. In some areas, they won't take any more Medicaid patients, and Planned Parenthood is the only entity.
And it is true that the Medicare and the targeted audience or group that use Planned Parenthood are often those who are most at risk. African American minority women die at a higher level than any other population when it comes to breast cancer, when it comes to actually dying from having pelvic or cervical cancer. So we are actually giving opportunities. I want to interject or ask Mr. Chairman, unanimous consent, to enter a letter into the record from Latino organizations that stated that they know for a fact in their communities, the community health centers could not absorb this. And I just want to close because I only have 2 seconds.
Without objection, so ordered, but you gentlewoman's time has expired.
Thank you.
Thank you. We'll now recognize the gentleman from Arizona, Mr. Gosar.
Mr. Chairman, I yield my time to the gentlewoman from Utah, Ms. Love.
Thank you. I'm right here.
Thank you.
First of all, I want to say thank you for coming and answering questions. I want to be very clear that there are no gotcha questions here. I just want to be able to get as much information as possible. I'm not here to try and change your mind or change the minds of my colleagues. I'm just trying to get as much information out to the public as we possibly can, because some of these funds are their taxpayer dollars, and I think that they deserve to have some answers. First of all, Ms. Richards, in the annual report, Planned Parenthood's annual report, says that you are providing over 489,000 breast cancer screenings, and you've stated that none of your clinics actually have the mammogram machines. How many of your affiliates have those mammogram machines?
Well, our health centers are part of our affiliates. We have more than 650 health centers. So affiliate is simply the corporate structure for those health centers.
And how many of them have mammogram machines?
The affiliate isn't a health center.
Okay,
I think I spoke earlier, we do not have mammogram machines at our health centers, and we've never stated that we did, as I think was mentioned earlier. For women who go for a breast exam, just as I go to for my annual, you get a breast exam, and if you need a mammogram, you're referred to a radiological clinic, and that's what we do at Planned Parenthood
Okay,
every
so
day.
you refer them to radiological clinics.
Or whatever, we have partnerships with the Komen Foundation.
Okay,
We have a lot of different
that's what-
ways in which we refer
That's
for
what I want to know.
mammograms.
Okay, so how much does Planned Parenthood make from cancer screenings? Do you know how much you make, how much
we make from
Yeah, how much,
cancers?
yes, the revenues.
For federal, so just talking the federal funding, we don't make money off of cancer
Okay,
screening.
that's great. How much do, well, you don't get anything from mammograms either. How much is made from abortions? What's the revenue that comes in from abortions?
Let me just, you're going to have to bear with me a minute so I can be responsive. I know you only have a little bit of time.
So if you could just respond as quickly as possible.
Okay. There are 59 affiliates. Each of them are completely different, right? They all run their own operation, and I can't tell you, I think this question was raised earlier, I can't tell you
tell me how much
specific
you actually
economics.
make from abortions. You can't give that number. Okay.
The national office, just also so you know, we do not provide health services at the national office. We've provided information for all 59 affiliates, their annual, their audited financial statements.
I wasn't even asking about the affiliates. I'm just
that's where health services are provided, so I think that's
okay.
relevant to
but
your
you don't.
question.
Okay, but you don't have those numbers. All you're saying is that the healthcare affiliates have these numbers, and you don't have them, so you don't know.
Certainly not at my
Okay.
fingertips.
So for the year ending in June 30th, 2014, according to Planned Parenthood reports, 127.1 million in revenue over expenses. From 2005 to 2013, Planned Parenthood reported a 53% reduction in cancer screenings and prevention services and 42% reduction in breast exams and breast care, while abortions have increased 24%. Can you understand a little bit of the hesitancy and trying to figure out why those numbers have gone down where abortions have actually gone up?
Okay, so we're talking about two different, I'm trying to, so we don't mix apples and oranges here. So federal funding pays, Medicaid funding and Title X pays for very specific preventive care services, as we've discussed.
So,
and federal funding does not pay for abortion
so
except
what
in
I'm
very
trying
limited
to say
circumstances.
is, why would it be so offensive if we actually took funding and put it into clinics that actually provide, where those numbers are actually increasing, providing healthcare exam, providing mammograms,
you're providing
that actually have those?
The Medicaid reimbursements, if they are going up, if the numbers are going up, that's because more services are being provided. And as you know, many women now, because of the Affordable Care Act and Medicaid expansion, there are more patients on Medicaid that are coming to us for health care. So that's, all of the reimbursements are directly related to healthcare delivery services. We work, Planned Parenthood is, you were not here earlier, but I'll tell you, Planned Parenthood is just like any other hospital or healthcare provider that provides
but you
services
have also
to Medicaid
made it,
patients.
You've also made it very clear that if Planned Parenthood wasn't around, this would be very difficult for low-income families. So what is the responsibility of hospitals and other clinics that, that you actually, that people can actually go to? I mean, you can't say that Planned Parenthood is like the only place that is available.
But obviously it's a place that 2.7 million patients choose voluntarily to come to every year. And I think what's important is that in a lot of areas of the country, they won't take more Medicaid
to go, but
patients.
what is our job here? Is to provide as many options as possible. So all I'm saying is that
I would agree.
There's no reason why we can't provide those options elsewhere, where people can have their choice as to where they go.
Exactly, Congresswoman. I think actually this may be an area where you and I agree.
My time is up, but Mr. Chairman,
I'd like the chance to answer.
You did actually. You answered my questions. Mr. Chairman, if you could help in getting some of the information about how much the numbers that I've asked for, that would be really helpful.
I appreciate it. The gentleman from Arizona who yielded to you, his time has expired. I would ask unanimous consent to take, there are 4 pages from the annual reports where we have the documentation on the reduction in the breast exams and breast care. And so without objection, I'd like to enter that into the record. No objections, so ordered. We now recognize the gentleman from California, Mr. Liu, for 5 minutes.
Thank you, Mr. Chair. Thank you, Ms. Richards, for your testimony and the gracefulness in which you've answered the questions today. I want to also thank you for running an organization that has helped millions of women and men across America. And on behalf of the majority of women and men in this great nation, I want to say thank you. And having sat here for the last hour and a half, I feel like I'm in some sort of bizarre alternate universe. I think it's crazy we're having this hearing based on heavily edited videos and misleading videos that actually show the exact opposite of what was happening. And what was happening was that Planned Parenthood was following the law. I think it's also crazy that we're here when we have fetal tissue research that is not only entirely legal, but has bipartisan support. And I think it's insane that in my district now, because of these misleading videos, women have, in some cases, had to go through 2 sets of bomb-proof doors just to access health care. And I thank you for your courage, and I note the cowardliness of the maker of these videos, who is too scared to come before us to testify. So let's just come back to reality for a few minutes. Abortion is legal in the United States of America. Isn't that correct, Ms. Richards?
It is correct.
And we don't live in a theocracy. The law of the land is not the Old Testament or the New Testament or the Quran or the Torah. The law of the land is the Constitution of the United States. Isn't that correct, Ms. Richards?
Correct.
And abortion is a constitutional right. Isn't that correct?
Correct.
And Planned Parenthood allows women to access that constitutional right. Isn't that correct?
Yes, we do.
And none of that gets any federal funding. Isn't that correct?
That's correct, except in the very limited circumstances allowed by federal law.
Thank you. Now, there are multiple medical clinics across America that also provide abortion services, correct?
I'm sorry, could you
That
repeat?
also, there are multiple medical clinics and
And
hospitals
hospitals.
across America that provide abortion services, correct?
Correct.
And they also provide services that have Medicaid reimbursement, isn't that correct?
I believe that's correct, yes.
And no one is saying, let's shut down medical clinics and hospitals because they also happen to provide abortion services, isn't that correct?
I don't think that's been
Right.
proposed.
In fact, they're going right after Planned Parenthood, even though you do the same thing as many of these medical clinics, because you actually, like any organization, have separate line items. That's not a new or novel concept, correct?
Correct.
Okay. So let's talk about fetal tissue research. It has made enormous life-saving changes for millions of Americans and people across the world. Isn't that correct?
That's right.
In fact, fetal tissue research has resulted directly in the development of the polio vaccine, vaccines for hepatitis A, rubella, chickenpox, shingles, and rabies. Anyone in America that has had a family member or themselves been affected by multiple sclerosis, ALS, and other central nervous system diseases, you can thank fetal tissue research for making advancements in that field. If anyone has been affected by age-related macular degeneration, by all sorts of cancer, by diabetes, by cardiovascular disease, by immune system issues, and by glaucoma, you can thank fetal tissue research for making advancements in those areas. It is crazy that we're here because the other side wants to shut down government because Planned Parenthood was following the law, because fetal tissue research is something that's helping lots of people, and now we want to shut down government because we want to defund all of that. That doesn't make any sense to me. And let me sort of conclude now by asking you to respond to sort of the questions about why there's been a reduction in cancer screenings. Isn't it true it's because guidelines have changed? They said, let's do less mammograms. And then in terms of Medicaid reimbursements, guidelines changed there too about pap smears. Let's do less of those too. Isn't that correct?
That's correct, and we always follow the best science and the best medicine at Planned Parenthood.
And then let me read a quick letter from one of my constituents who saw that Planned Parenthood might get defunded. She said that she grew up in a small desert town, made some poor choices, ditched school at age 15, started having sex, and she didn't want to end up pregnant like a lot of young girls in my town, so she went to the one place that she knew would help her, Planned Parenthood. They made her feel comfortable. They gave her an exam, gave her birth control pills, told her that she had an STD when needed to take antibiotics. Yep. She says without that, the STD could have made me permanently infertile. But because of what Planned Parenthood did, she corrected herself, graduated straight A's, and is now a medical doctor. And she thanks Planned Parenthood for helping her and her family.
I'm so pleased to hear that. Thanks for sharing that.
Thank the gentleman, but I would also admonish all members on both sides. The prescription of motivation is not something we generally allow members to push on other members. I will tell you, in response to what the gentleman said, the producer of these videos was not invited to this hearing. And part of the reason we didn't do that is I think I did the responsible thing, and you've heard Mr. Cummings in support of this, is I issued a subpoena to get all the videos. And the only reason that they have not been produced is that there's a temporary restraining order by a court in California. I would love to have the videos. But if we're going to ferret out what these accusation is, you have to see all the videos. And that's what we're trying to do. But there was never a suggestion that this gentleman, Mr. Delaney, was anything but cooperative. He simply was not invited here because without the videos, we can't have a good discussion about that.
Thank you, Mr. Chair, for that
Cummings,
clarification.
Chairman, let me just ask you this. With this order coming out of California, are we going to continue to try to get all of the videos? I see how we have been aggressive with regard to getting witnesses and trying to get documents, and this is such a very important issue. And as I've said to you privately, I think that What I'm concerned about is the integrity of the process, no matter what, no matter where people end up on either end. At least I want, if these videos are going to be even partially the foundation of what we're doing, I think we need to have all of them, and we need to pursue them, just like we would pursue other items and information that we need. And I just asked the chairman, are we going to continue to try to pursue that? I mean,
Absolutely. That's what we did.
we'll
Without the
continue to
support,
do.
we will continue to do it. That's what we did without the support of the minority in this case. We will continue to do that. But for this temporary restraining order, I think we would actually have had them by the time that we got here, but we did not. We will continue to pursue them. We're working closely with House Legal Counsel, who is now representing us, to try to make that case to that court and to that client where there is a legitimate conflict.
Gentlemen, you'll just for 30 seconds. Let me make it very, very clear that you now said it 2 or 3 times, and I want to make it clear. We will join you in a subpoena to get every single tape, period. No ands, no ifs or buts, period. And I don't know where that's coming from, but as a ranking member of this committee, I'm letting you know that, all right?
I appreciate it. Thank you. Thank you. Appreciate the clarification. Now we'll recognize the gentleman from Tennessee, Mr. Desjardins, for 5 minutes.
Thank you, Mr. Chairman, and I would like to yield to the gentleman from Arizona, Dr. Gozar.
Well, I thank the gentleman. Mr. Cummings, you made a comment earlier that I want to address. In the New York Times reported that the EPA unleashed a major lobbying campaign to rally comments and support for its new waters of the U.S. regulation. You earlier went off on Lockheed Martin in regards to that application. I have to tell you, the EPA also disregarded the Anti-Lobbying Act and broke the law. If you actually believe in what you were talking and preaching about, I'd hope that you would co-sponsor my removal of Ms. Gina McCarthy as the EPA administrator. Now back to those processes in here. Ms. Richards, I'm up here. You're a CEO, right?
Yes, sir.
So you do understand market penetration, right?
Well, I mean, I'm a nonprofit CEO, so.
But I mean, you look at those numbers. I mean, all CEOs are looking at, how they expand and profit. I mean, you're obviously
We don't profit, so I don't actually look at how to profit, but we do obviously look how to expand into areas, particularly where there's unmet need.
Okay, I like that. So your market penetration in Arizona is different than your market penetration in New York State, would you say?
I'm sure it is.
Yeah, there's 3 in Arizona, and there's quite a few more in New York, and there's a pretty good web of preventative services. So I kind of want to go back. In your annual report, reports that $117.63 million in excess revenues for the fiscal year of 2013-2014. That number has jumped $18.5 million from its report in 2009-2010. I'd like you to tell me how you got the growth of those funds. Why we're seeing such a growth in that profit?
Well, it's not so let me just be really clear, just in terms of terminology. It's not profit. It's revenue that we use for services. So one example.
So would we agree that it's excesses of revenue over expenses?
Correct.
Okay.
Exactly. So
how do you explain that?
Right. It's from fundraising. That's what I spend a lot of my time doing. And so there are areas of the country where we want to expand. To your question about if you only have one health center in a state and you think that there's more need. So we are involved currently in raising money and spending it. Okay. We just opened a new health center.
You gave me a great answer.
I could give you several examples.
You fundraised, and I think that. So.
But we fundraise specifically to expand services.
I understand that. I understand that. So what are you looking to report in 2014?
I'm sorry, what's that?
So what's that number in 2014?
I don't have all the, I mean, we provided, thousands of pages of documents.
It's actually going up. It's actually going up to 127 million in regards to it. So there's an escalating aspect. So you're a pretty good CEO. So you're looking at excess revenues over expenses. So that's pretty good. I'm having trouble in all this in regards to the fundraising application, particularly when I look at these numbers. The 80% reduction in prenatal care services, the 57% reduction in cancer screenings preventive services, the 45% reduction in breast exams, on and on and on and on. And by the way, I was a dentist, so I do understand Medicaid reimbursement rates. They don't pay, right?
Correct.
Okay, so.
Well, it
you're
depends
lucky-
on the
You're
state.
lucky if you get reimbursed your costs.
Well, and actually, I would say, since you do understand Medicaid, as you know, it varies in all 50 states, and so we do raise money over expenses in order to supplement the cost of
I
Medicaid
understand.
services.
So let me ask you a question. With a mediator, what have you been able to facilitate for a lump cost for the price of contraceptives? Is there a unit price that you've been able to lower down to get a price fixed? Can you give me that number?
I know, I actually don't, and I don't do that.
It's being reported by those numbers that it's about $3 that you're paying for the average contraceptive.
Actually, I really don't want to, it's very much all over the map, as you know, and it depends on
But
what.
I mean, on the average. And so,
It's not, I really, actually,
well,
I disagree with
this
you. I
is
don't
the very
think that fact is
salient
correct.
point, because this
Right.
is a profit center. Because what ends up happening, you're reimbursed by the federal government and Medicaid at $35, right? So if we're truly looking at mediation and spreading the wealth of the pharmaceuticals, when we get a break, we ought to pass it on. Don't you agree?
Well, as you know.
No, don't you agree? Because that facilitates more services, does it not, Ms. Richards?
Our entire focus is on serving as many patients as we can.
That's
And
not-
so
that's-
your example.
That is not exactly true,
You've got-
because what you've done now, and the reason I can show this is you've narrowed the focus. What we end up having is there's very few primary care docs out there because they can't afford to stay in practice. So what you've done is narrowed the scope of the practice, so where there's profit centers, you know?
I
This
just
is my
disagree.
time. This is my time, so don't interrupt it. And so from that standpoint, what you've done is narrowed that focus so that you're profiting off death. Because where you're making that profit center is actually off abortions. And that's appalling to me. So thank you very much.
Thank the gentleman. We'll now recognize the gentlewoman from New Jersey, Ms. Watson Coleman, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Richards, for enduring what I consider to be a very offensive approach on the part of my colleagues on the other side of the aisle as they've badgered you with questions, as they've used their rhetoric to suggest in a questionable way that they're seeking information, at the same time not giving you a chance to answer the questions. I'm actually a little confused of why we're here. Are we here because of these videos and there's a questionability about Planned Parenthood doing something that's illegal as it related to the collection of fetal tissue? Are we here simply because the ideological right wing of this Republican conference here in Congress, the dysfunction is manifested, simply so anti-woman's right to choose that they would bring you here for a fourth hearing? Or are we here because somebody believes that Planned Parenthood doesn't need federal reimbursement for the health care that it gives? For whatever reason, for whatever one of those reasons, those are specious reasons. And for my colleagues on the other side of the aisle to act like they don't understand and to suggest that they're ill-informed, if they are ill-informed, it's because they choose to be. I couldn't hardly get into this room today with all of the people on the outside in the hallways that were trying to get in here to be supportive of Planned Parenthood, because we know and recognize the impact that Planned Parenthood has had on healthy lives, not just women's lives, but including men's lives. We know in New Jersey, in my state, where this governor, Chris Christie, spent so much of his leverage defunding Planned Parenthood and then suggesting that the federally qualified health care centers would be able to pick up the slack. They came in and testified that they couldn't possibly accommodate all of the deficiencies that would occur without Planned Parenthood. We know that the work that you do. So I just want to do a couple of things, and I want to do them quickly. I want to acknowledge all the young women and men in the overflow room. I want to talk to you a little about Mr. Deledens or Delighten or whatever his name is, but the mystery man who spent so much of his life trying to discredit Planned Parenthood. You all had a forensic report done.
Correct.
On those videos.
Correct.
And that forensic report revealed that there were so many discrepancies, that there were so many inaccuracies, and that it would be impossible to characterize the extent to which CMP's undisclosed edits and cuts distort the meaning of the encounters of videos purport to document. However, the manipulation of the videos does not mean they have no evidentiary value in legal context and cannot be relied upon. I want to put that report into the record, and I am asking unanimous consent to accept this forensic report, because somewhere along the line, we ought to be getting part of the other story. Mr. Chairman?
Before I rule on that, I'll place a temporary objection in place. Let me look at the report prior to entering it into the record.
Well, then, I guess I should also register my temporary objection to the fact that we have one witness here, and we haven't even tried to get Mr. DeLayden here or anyone else who we would be able to question as with regard to the accuracy of all the allegations that we are moving on right now. And I also want to say, before I give you an opportunity to answer any question that was left out there in the universe hovering over us, so that you can put things that you think that are on the record, that this is another very poor illustration of our deflecting our attention away from the work that the people have elected us to do. We need to have an export-import bank that creates jobs. We need to have an infrastructure program that creates jobs. We need to be reauthorizing the appropriate aspects of the Voting Rights Act. We've got so much good work to do, but instead, what do? We harp on a woman's right to make the choices that are hers to make. And that, to me, is very offensive. And with that, Ms. Richards, I would like to yield to you the balance of my time to answer any unanswered question that you may have. Thank you.
Thank you so much, Congresswoman. Well, I would mention, too, to the chairman that I believe we've actually given the forensic report already to you and provided that a while back, but we can follow up if there's any questions. I appreciate your comments. I think we have now had, either today, for the 14th vote will be on restricting women's access to health care in this country. And I think going back to one of the questions on the other side, this is about women's choice to me. This isn't about Planned Parenthood. It's about allowing women in this country, and particularly women of low income or live in areas that are underserved by other health care providers, it's allowing them to make their own decision about their pregnancies, about their health care, and about where they get services. And many women come to us even if they have other options because, frankly, we're the best at women's health. And I think they deserve the right to make their own decisions about where they access the doctor and clinicians of their choice.
Reclaiming the last 25 seconds of my time, it seems to me to be...
Gentlewoman's time is more than expired.
Oh, I'm so sorry. Would you indulge me for 10 seconds?
If I do that, I've got to do it both. I've got to keep going.
With all due respect, Mr. Chairman, you have
10 seconds.
It just seems to me that this is not the appropriate time to be making decisions about defunding Planned Parenthood when we don't even know why we want to do it.
Thank you. So, the gentlewoman had asked unanimous consent to enter into the record, this GPS fusion analysis. I'd also like to add on to that, if I could, the digital forensic analysis report delivered to Alliance Defending Freedom prepared by Coal Fire Systems. I'd ask unanimous consent that both of these be entered into the record. Without objection, so ordered. We'll now recognize the gentleman from Texas, Mr. Farenthold, for 5 minutes.
Thank you, Mr. Chairman, and I might want to talk a little bit about one of the reasons we need to take a closer look at the funding of Planned Parenthood, not just as a result of these videos, but as a result of some financial issues that are coming up. As president of Planned Parenthood, you're aware, of course, that Planned Parenthood of the Gulf Coast, that's the Houston area, Planned Parenthood last year paid a $4.3 million settlement for false claims made to Medicaid and the Texas Women's Health Care Program. Is that not correct?
That's correct.
And you're also aware that the Obama administration's Department of Justice contended that Planned Parenthood had submitted false claims against the Women's Health Program.
I'm not aware of that. I do know that we've been the target of the same group that has filed many, many, many lawsuits, and that's the one area I know that was settled in order for the
well, let me read a little bit from the settlement. It's the United States contends that Planned Parenthood of the Gulf Coast submitted false claims and made false statements to the United States in conjunction with claims submitted to the United States. And just, Mr. Chairman, without objection, I would like to have this settlement agreement entered into the record.
Without objection, so ordered.
All right, so as a consequence, Planned Parenthood paid $4.3 million to settle those claims just 2 years ago. Are you aware that this spring another audit by HHS Office of the Inspector General concluded that Planned Parenthood had overbilled taxpayers another $128,028 under Medicaid and the Texas Women's Health Program?
I'm not aware of what you're referring to. I'm happy to look at it.
Thank you. And are you aware that the Planned Parenthood affiliate in El Paso, just a few years before, had failed to reimburse its subcontractors for roughly $500,000 in claims?
I'm not aware of that, and that organization doesn't exist and hasn't for years, but I'm happy to look at your
And actually,
report.
that is another issue I would like to bring up. One of the things that we're talking about today is taking some of the money that's going to Planned Parenthood and sending it to community health centers. Do you know how many facilities in Texas you have?
I don't, but I can certainly, actually, bear with me 1 minute. I'll just make sure I give you the right number. Now, this may be, I know we just opened one in Plano, so I think we have 38 health centers.
And there
Now, maybe 39 now.
And so we've got 732 community health centers. Admittedly, some of those focus on pediatrics or men's health care or other specialties. But wouldn't you admit there's substantially more facilities, federally qualified facilities that offer women's health care than there are Planned Parenthood facilities in Texas?
Well, actually, I think, Congressman, one of the big problems in Texas is there has actually been a drop in access to women for health care. And particularly after Planned Parenthood was, for political reasons, I believe, taken out of the women's health program, we had a 25% drop in women's access to basic preventive care, and particularly in some areas like the Rio Grande border that are vastly underserved.
I think y'all have 3 or 4 facilities down in the Rio Grande Valley, if I'm not mistaken. I also promised to ask you a couple of questions that some constituents and folks on social media asked me to ask, so I'd like to use my last minute and a half to do that. Lauren wanted me to ask you what efforts and what steps does Planned Parenthood take to guarantee their providers follow state laws requiring reporting of child sex abuse?
We have very rigorous standards that we apply. The health and well-being of our patients is our number 1 concern, and we certainly comply with all state and federal laws, and if there's ever an issue, we take swift action.
Okay, and then Peg and Allison both expressed a concern about the same thing the chairman did when he began this questioning about the activities of the 501c4 organization that Planned Parenthood has helped fund, you've helped manage, and funds have been transferred into for lobbying in almost exclusively Democrat political campaigns. One of my concerns is with your purported goal of making access to women's health care more available, isn't the money that you are diverting to lobbying effort in politics money that could better be spent actually delivering health care to women?
Well, Congressman, as you know, in the state of Texas, the number of laws that the state legislature has passed to try to restrict women's access to almost every kind of health care requires not only the Planned Parenthood Action Fund, but other organizations to lobby extensively to try to protect particularly low-income women.
One more. As you also spoke earlier about how you have doctors that are providing women's health care, and those doctors are funded by the taxpayer money under Title X or other reimbursements. Are some of those doctors also providing abortion? Would you be able to afford to have those doctors and keep them entirely busy but for the federal funds coming in?
I'm not sure exactly. That's a kind of long, complicated question, so I want to be responsive. Obviously, federal funds, the most important thing, I think, out of all of that is federal funds do not pay for abortions at all, except in very limited circumstances of when the woman has been raped, has been the victim of incest, or when her life is endangered.
And I would contend, even though not directly spent, they help facilitate it, and that's one of the reasons I support defunding. I see I'm out of time. I appreciate it. Thank you, Mr. Chairman.
I thank the gentleman. Before I recognize Mr. Desaunier from California, after he does his questioning, we're going to do a brief 4 to 5 minute break, sort of a humanitarian break for a moment, and then we will continue on until we get the chance for the rest of the panel. For those in the audience, I suggest remaining in your seats if you want to continue to witness the hearing. For those members who have yet to ask questions, hang tight, but we'll go to Mr. Desaunier for 5 minutes, and then we'll take a very brief break, and then we'll resume.
Thank you, Mr. Chairman.
Now
I don't know quite how to take that break after my questioning. Usually, it's better to take a break before I ask questions. Anyways, I want to thank you, Ms. Richards, for being here, the way you've carried yourself through this hearing and through this recent history,
and the wonderful work that your organization does. And I want to sort of two lines of questioning. One, the latter part, very specific on the bipartisan history of support for fetal tissue research. But the first part is just in my experience in state government in California and then local government, particularly in local government, and in California, the counties provide health care for disadvantaged communities, low-income communities. It was always my experience that the clients chose Planned Parenthood when they had the opportunity because they wanted to, whether they were a private pay or not. And we developed relationships between the county health system and you because the clients clearly preferred you, at least in our community. So in the spirit of local control, it seems to me within the federal guidance, you competed very well in the open marketplace, whether it was private pay or reimbursed clients. Is that not true?
Well, I appreciate that, and absolutely providing high-quality, affordable health care is our entire mission, and so we are pleased that many women and men, now we have about 10% of our patients are men, they choose Planned Parenthood over other healthcare providers. We believe we provide an excellent service that's affordable, and we do a lot of outreach in the community to provide education as well.
Yeah, and that was my experience, was that in local government you were more efficient and effective, certainly than, with all due respect to my friends in the county system, So with my colleagues, this is one of those instances where it's a little bit odd listening here, and without being judgmental, it reminds me of the old legal expression, when the law is with you, pound the law, when it's not, you pound the table. And that's just my perspective. Having said all that, on the specific issue of bipartisan historical support for fetal tissue research, 1988, maybe you could just respond after I go through a series of these observations, if this is correct or not, and if you have any other comments. So in 1988, there was a panel called the Human Fetal Tissue Transplantation Research Panel, and that panel was established under President Reagan. The chairman was a Republican. The panel came together and studied the science behind fetal tissue research, and they issued this conclusion, and I quote, "It was acceptable public policy to support transplant research with fetal tissue." Now, just to be clear, that was a Republican chair of a panel established under President Reagan. Is that accurate?
That's correct, and I've now just learned more about the history, but it was a committee that had both supporters of abortion rights, opponents of abortion rights. It was a very bipartisan effort to come to what seems like a very good conclusion that was passed overwhelmingly by the United States Senate.
Right, and this panel issued its report. Congress passed after the report, and consulting with the report, passed the NIH Revitalization Act of 1993, and that law set forth the rules of how fetal tissue research is done in this country. That law, again, was passed with Republican and Democratic support. That's correct, isn't it?
That's correct.
So the bipartisan line is that for decades, fetal tissue research has had significant bipartisan support. One of the reasons this research has had such strong support, and Mr. Liu alluded to this, is because it helps millions of people. Recently, the New England Journal of Medicine published an article, and its observations in this regard were, and I quote, "Virtually every person in this country has benefited from research using fetal tissue. Every child who's been spared the risks and misery of chickenpox, rubella, or polio can thank the Nobel Prize recipients and other scientists who use such tissue in research yielding the vaccines that protect us." Would you agree with that?
That's correct. I think probably everyone in this room has benefited in some way.
So just in conclusion, again, thank you for the work you do. And Mr. Chairman, while I appreciate your initial comments, particularly as we evaluate, as always, the best and most efficient use of taxpayers' money, at least from my perspective, in my opinion, both from the local level of 14 years of overseeing a relationship in the Bay Area with affiliates there, at least at that level, we did our due diligence, and this was the most effective and efficient way of investing in our clients' needs. So with that, I'll yield back.
Glad to hear it. Thank you.
Gentlemen, yield?
Yes.
Just one quick question, Ms. Richards. What do you like most about your job?
What do I like most about my job is getting to see the patients that we serve every day and the young people who are, frankly, going to have, I think, more opportunities than we ever did. It's great.
Thank you.
Gentlemen's time has expired. As I noticed prior, we are going to recess for roughly 5 minutes, but we intend to start back up again at 12:35. We stand in recess till then.
Sarah, they're coming. Yeah.
If the members of the audience would please take their seats, then we'll know if we can bring additional people in who may still be waiting. We're about to begin here as soon as we get our witness here. There she is. Committee will come to order. The next person to be recognized is the gentleman from North Carolina, Mr. Meadows, for 5 minutes.
Thank you, Mr. Chairman. Ms. Richards, thank you for your testimony. I'm going to try to take the emotion out of it and stick strictly to the numbers. Earlier you said you need to consider the source, so everything that I'll be quoting comes from Planned Parenthood. It is my understanding that 3%, according to your website and your testimony today, 3% of the services that Planned Parenthood offers are abortion services. Is that correct? 3%. Of your total services, 3%.
Sorry, my mic wasn't on. 3% of the services delivered, of the total services.
But yet you say that you don't have the total amount of money, you can't give this committee the total amount of money that's you make or receive for abortions. Is that correct?
It's because the national office doesn't, as you know, or may not know, but the national office doesn't provide health care services. 59 affiliates provide a variety of health care services, so that would be, every single organization would be
But your affiliates gather that information, so you would have access to that.
Well, I'm sure they have it. I don't have it myself.
Okay, but how do you come up with 3%? So
that's the number of service, because
let me ask the question. Okay. 2.7 million women and men are served by Planned Parenthood, according to your testimony. Is that correct? 2.7.
That's correct.
Annually, you provide, according to your report, 327,000 plus abortions last year, according to your annual report. I do the math. 2.7 million people, 327,000 abortions. That comes up to 12%. So how do you get 3%? And these are your numbers. Why is it not 12%?
Well, because people come to us some people come to us more than once, and they come to us for different services, and some people come to us and they need a pap smear, they need a variety of services.
Let's go on a little bit further, because I'm having a real trouble coming to this. And if you would put up the graph on, this is a tax return from one of your affiliates in Rochester, Syracuse region. If you could read for me line 2B. What does that say? What is the designation there?
Pregnancy termination.
Okay, and the dollar amount next to pregnancy termination there is how much?
Again, I've never seen this before, so I'm simply reading what you're asking me to read. 1,424,275. I'm assuming.
All right, so $1,424,000 for pregnancy termination, according to your affiliate's tax return.
One affiliate, correct.
Okay, so wouldn't you have tax returns for all your affiliates where we could get this information?
Well, I know that we have provided.
Okay, because here's my concern. If you take the number, that 1.4 million, and divide it into the total revenue of a little over 5 million, that would indicate revenues of almost 28% for abortions.
Well, I
So
think
where
we're
does the
mixing
3%?
services, and I think you're mixing services and revenue, because obviously above the above line says family planning, 3,718,474.
But wouldn't you think the 3% is a little bit misleading?
No,
if
actually, we
28%?
calculate, I mean, we are,
Well,
I'd say we are the most highly regulated organization probably in this
oh,
country.
well, I would
We-
disagree with that, but let me,
well,
let me
anyway,
ask
and-
you.
But we're very transparent about our numbers.
I've got this for one of your affiliates. Will you provide this same kind of documentation for all your affiliates to this committee?
I believe we actually already have.
No, you haven't.
Well, I'm happy to speak to the chairman because we have, I
This
believe.
is the only one that had it. Will you today, yes or no, provide this for all your affiliates?
We have produced all 990. Okay, well, we just have a disagreement of opinion, and I'm happy to talk to
Well, it's not a
Chair-
disagreement. Will you provide the number
We have
of
already
revenue?
provided the 990s for all of our affiliates, and so
But
that's
it didn't outline it like this.
well, maybe perhaps.
So are
I
you
don't,
saying that you don't keep track of it?
you said that. I did not say that.
No, I'm asking you. Do you keep track of it?
Every single affiliate in Planned Parenthood meets with all the laws and regulations, and they file their 990s, and we
That's a
provided.
great answer to a question
Chairman,
I didn't
we've-
ask.
We've
Would you
provided.
provide it to this committee?
I don't exactly know what it is, since I've said to you
Okay, well,
repeatedly.
I'll tell you what it
We've
is.
provided
The
the 990s.
revenue that you, Planned Parenthood, derives from abortions.
And I have said to you, we have provided, and we have been extremely cooperative with this committee and the other three committees, and we have provided all the 990s, all the audit annual statements of our affiliates, and if there's anything after, I'm happy to talk to the staff here about what else is needed that we're not providing, because I really believe we have gone above and beyond in providing everything that's been requested of us.
Okay, my time's
And it's-
expired. I'll yield back, Mr. Chairman. Thank you.
Thank you. And now recognize the gentleman from Pennsylvania, Mr. Boyle, for 5 minutes.
Thank you. Thank you, Mr. Chairman. And I also want to thank Ms. Richards for the manner in which you've conducted yourself today. There was one answer you've given that surprised me when Ranking Member Cummings asked what the favorite part of your job was. I assumed you were going to say sitting here for 3 hours answering these questions from members of Congress. But I do want to focus, a couple of these statistics have been cited before, a couple have not, but I don't think they've strongly led to a very important point, and that would be the consequences of the legislative action that we're proposing. So let me just briefly go through. As has been cited, there are approximately 2.5, actually exactly 2.7 million women and men that Planned Parenthood see every year, correct?
Give that to you. Correct.
And of that, 1.5 million of those patients receive services through Title X, the nation's family planning program, right?
Well, I think that, and I'm not, let me make sure that I want to make sure I answer you correctly. About 1.6 million of our patients are come to us through some federal program, either Title X or the Medicaid program. But a number of them are Title X recipients.
Well, contraceptive services at Title X centers annually prevent 1.2 million unintended pregnancies, which would result significantly in 590,000 unplanned births, 400,000 abortions, and 190,000 miscarriages. So in a country with approximately 1 million abortions a year, what we're talking about is without such Title X services, the services that Planned Parenthood provides and clearly constitutes the majority of your work, the number of abortions each year in the U.S. would be approximately 40% higher.
Yes.
I think that the consequences of what we're talking about haven't fully been laid out, not just in terms of the cancer screenings and the treatment of STDs, but also, ironically, in what would be inevitably an increase in the number of unintended pregnancies and abortions.
That's correct, and it's interesting because right now there's such exciting research happening with better contraceptives. Young women now can get long-acting reversible contraceptives. They don't even have some. I know I've been questioned about why in some cases we have fewer visits in some areas. And one of the exciting things is now you actually sometimes don't have to come back to Planned Parenthood every month to get birth control pills, because we can provide them for 6 months, or you can get a longer acting method. And in the states that have really pioneered this work to provide women any birth control, we're seeing dramatic drops in both unintended pregnancy rate and abortion rates.
I also, and by the way, I think that's something that we can all celebrate, and maybe the focus should be more on how best to provide women the health care they need, and that actually this is something where we can build common ground. I did also want to point out, and I think you cited this before, and it's only been mentioned once in these 3 hours. According to the Nonpartisan Congressional Budget Office, if this legislation goes through, 390,000 women would lose their access to health care.
That's correct.
Where else could they turn?
Well, I think that's the difficulty in that. You're right. I appreciate you bringing back up the CBO study, because it's really important. As I said earlier, there are some areas of the country where we are the only safety net family planning provider. There's other areas where the Medicaid folks who are taking Medicaid patients won't take anymore, because as has been discussed by everyone, Medicaid payments don't necessarily pay for services. But the other thing I'd like to just emphasize is that there are women and young people that choose Planned Parenthood even though they have other options, because we provide very high quality health care, particularly family planning services, that they may not be able to get anywhere else without judgment, without shame.
Per one of the points you were making in terms of the population that Planned Parenthood serves, the statistic I have, and I think that you've cited, is that at least 78% of Planned Parenthood's health care patients have incomes of 150% of the income of the poverty level or less.
That's correct. That's correct.
So it's pretty clear we're talking about people who don't have a great deal of options in anything given their income.
Well, and to me, that is the point, is that I believe low-income women in this country should have all the same options to have high-quality, affordable health care as every other woman.
Thank you. And with 11 seconds left, I'll yield back.
Thank you.
Thank the gentleman. Now recognize the gentleman from Florida, Mr. DeSantis, for 5 minutes.
Thank you, Mr. Chairman. Ms. Richards, if a child survives an abortion attempt, should it be given nourishment and medical care?
I've never heard of such a circumstance happening.
Really?
Yes. I mean,
So if
certainly,
it did happen, you would say it would
well,
be
I can say at
entitled to it or
Planned
not?
Parenthood, I'm aware of no instance where we don't provide abortions after viability. So, but I certainly, it's in my experience at Planned Parenthood, we haven't ever had that kind of circumstance.
But you would say that there would be medical care would be in order at that point. Forget about Planned Parenthood, just generally.
Well, I'd say, I mean, again, I want to be responsible for Planned Parenthood and what we do there. Certainly in this situation, which again has never occurred that I know of a baby born, that baby should, as the mother should, get appropriate medical care from the physician.
Now, have you watched all the videos released by the Center for Medical Progress?
I haven't watched the multi-hour edited videos, but I have read all of the written transcripts.
So the ones that are on YouTube, you haven't watched those? I know there have been a series.
Well, there have been like hours and hours and hours, so I haven't, I mean, I did read through all the, I've watched many of the videos, and I've read through all the transcripts that have been provided. Again, I would say it's important that my position is I would like to see all of the videos that are not edited, and those haven't been provided.
What about, there was one specific one that there was a technician, Holly O'Donnell, that she was describing harvesting the brain of a late-term boy. She said she wasn't sure if the baby was alive since its heart was still beating, and then she harvested the brain by cutting his head open, starting with the chin. Do you recall that?
That woman does not work for Planned Parenthood, so I can't really speak to anything that she said. I'm not responsible for her.
Do you deny that her description of what happened is something that does occur in Planned Parenthood clinics?
Absolutely. I've never,
affiliates?
There's nothing that she's ever described that I could attest to has ever happened. And
So you can categorically testify to that then?
Categorically testify to what? Because I would be very careful what you're
that
asking.
what she described is
Well, I
not
don't
something
remember
would
that
occur.
particular video of Holly O'Donnell, but I will tell you she has never worked at Planned Parenthood, and I have.
She was a technician for STEM Express, but I think it was something that was very, very troubling to sit there and read that, or to sit there and watch that video. But let me ask you this: do you admit that Planned Parenthood or its affiliates harvests and sells fetal body parts for profit?
We are very clear at Planned Parenthood. We have a very clear policy on fetal tissue donation. It's done with the full consent of the patient. And as I said earlier in my statements, it is only currently done in fewer than 1% of Planned Parenthood health centers.
But no profit.
And in one affiliate in Washington State that does not receive any reimbursement for their costs, and there's only one other one which is in California, and they have assured us that whatever reimbursement they receive, it is less than what the costs are for providing fetal tissue to that organization.
If that's the case, then the video with Dr. Gutter negotiating over the price of the parts, if there's no profit being made, then why would you be negotiating over how much the parts are going to be sold for?
Well, with respect, I completely disagree with your characterization of that, and that is why I read all of the transcripts, the full, not these edited, sensationalized videos. And what I read, because we take this very seriously, I read over and over.
I understand.
I just disagree with your characterization.
And that's fine, and people can judge for what it is. Let me ask you this: do you deny that Planned Parenthood and/or its affiliates will alter abortion procedures in order to better harvest fetal body parts?
We have a very clear policy, which I'm happy to read to you, about how we allow patients to make fetal tissue donations. Would you like me to?
So since the release of the videos, have you or the Planned Parenthood Federation issued any updated guidance to the companies to whom you provide fetal tissue regarding the sale of fetal body parts for profit and/or the manipulation of abortion procedures?
Well, there's no way to answer that because I disagree with your formulation. We allow women voluntarily.
Have you issued any new guidance within the past 3 months?
No, although as I said in my letter to Congress, I've asked our chief medical officer and our medical team to review all the work we do, and again, it's very limited in fetal tissue donation, to ensure that if there are any things that we could be doing better, we would like to do that.
My time's expired.
Thank the gentleman. We'll now recognize the gentleman from Vermont, Mr. Welch, for 5 minutes.
Thank you very much. A couple of things preliminarily. Number one, there is a sharp disagreement on members of this committee about abortion, and I think each side is entitled to mutual respect. There is a significant disagreement about fetal tissue research, and each side is entitled to respect. What is clear is the law says abortion is legal, and the law has limited authorization for fetal tissue research. That's the law. What Planned Parenthood is doing is completely consistent with the law. We're now having an argument about a video that has been redacted and doctored. There's no dispute about that. All of us would like to get the entire video. And in a prudent investigatory process, we would get the evidence before we argued about the evidence that we don't have. So that is a limitation on our ability to get, quote, to the truth. Second, I'm just going to speak for Vermont. 16,000 women voluntarily choose to get their primary health care from Planned Parenthood. These are individuals of free will, acting on the basis of what they believe is in the best interest of them getting the health care that they need. Second, the proposal here that we could transfer the services that Planned Parenthood provides to our community health centers doesn't stand up in Vermont. We have community health centers that we're very proud of. Senator Sanders, Senator Leahy, and I have all been big promoters. But its clientele is a significantly different population than women who have made a choice to go to the Planned Parenthood for their women's health care issues. So this proposed remedy here would have an incredibly negative impact on the choice that Vermont women make about getting their basic health care. And by the way, that health care that's important to the woman who decides to go to Planned Parenthood is really appreciated by her family, their partners, in the community. So what is Congress doing here? We're having an argument that's never going to end about abortion, but we're proposing to proceed in a way where the effect of our, quote, investigation is going to have collateral consequences that compromises the ability of women to get access to basic health care needs. And it's also in the context where it's undisputed that the services that Planned Parenthood provides have helped reduce dramatically teen pregnancies and other pregnancies. So I think we should all take a step back here and think about what we do before we act. The first medical principle that all doctors follow: do no harm. Ms. Richards, I do want to ask you a couple of questions. This alarming inquiry about whether you were selling for, or Planned Parenthood was selling for profit body parts. We've seen a proposed contract from Mr. Deladian to send Planned Parenthood affiliate in Colorado earlier this year offering to buy tissue samples. And that contract included a compensation clause. Were you familiar with that document?
Yes, I am.
And in response, your affiliate removed the word compensation and added the following text, and I quote, "The payments shall not, under any circumstances, be calculated in such a way as to generate a profit for source." So, Ms. Richards, is that what the affiliate did, and was that the strict policy of Planned Parenthood?
So that's a very good example of what happened across the country. This group who, as I said, are committed to, they weren't really committed to rooting out any misdeeds. They were actually trying to entrap doctors and clinicians into signing bogus contracts and breaking the law. And so this example is a very good one of where they were completely rebuffed, and yet they continued to badger and badger and badger our doctors to try to get them to commit to something that was unethical or illegal.
And after your affiliate sent that deletion of the word compensation, did Mr. Deladian agree to the terms, or did he lose interest?
There was never a contract, that I know of that was actually sent back.
Let me ask another question about a failed attempt by Mr. Deladian. On July 20, you sent a letter to Chairman Upton. You said this, quote, "In another instance, Biomax offered to pay much more, sending the affiliate a procurement agreement that offered a payment of $1,600. Your letter says this was a, quote, astronomical amount compared to the reasonable cost affiliates are allowed to recoup under federal law. Is that right?"
I don't have that in front of me, but it sounds, to the best of my knowledge, it's correct.
All right. I see that I'm out of time, and I yield back. Thank you.
Thank the gentleman. We'll now recognize the gentleman from North Carolina, Mr. Walker, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Richards, for being here today. I appreciate your testimony. I am also married to a strong lady. She is a family nurse practitioner. Helped launch the sexual assault nurse examiner program at Wake Forest Baptist Medical Center many years ago. But we stand together. We have done work in our inner cities and places like Cleveland and Baltimore and New York. And I'm troubled with some of the statistics that we've even seen out of New York. And maybe you can address that. I want to talk over you. I want to give you a chance to respond. But according to New York Health Department statistics, we now know that there are more African-American babies that are aborted in New York than actually born alive. Are you aware of that statistic?
I'm not aware of that statistic.
Okay. If that is correct, would that concern you? Because obviously Planned Parenthood has more clinics in New York State than any other state.
Actually, that's not true. We do not.
What is the #1 leading state you have?
I believe it's California. I'll have to look, though, to make sure.
But if you know that's not
and
true.
And it's not only, I mean, Planned Parenthood, there are a number of healthcare providers in the state of New York beyond Planned Parenthood. It's one of the better served.
I understand, but we've already established that somewhere between 30 and 40% of all abortions come from your organization. So if we're going to put out the stats, we want to make sure that we're talking correct on the numbers.
And I do think, Mr. Walker, it's a really important point because I think one of the other, I'm not what all the statistics are that you have, but of course the lack of access for African American women in particular to basic preventive health care, including family planning, is a huge problem in this country.
It is, and I don't want to spend, and I agree with you, that's as a aforementioned time of places that we've served and worked in, but it does concern me that 3 times, the African American population is 13%, yet they're being aborted 3 times % of the population at 35%. That should concern all of us. I'm sure it concerns you as well. I do have a specific question regarding the $32 million that's sent overseas. Does Planned Parenthood send any funds to the Democratic Republic of Congo?
You know, this was asked earlier, and
We did touch on it, but I want to come back to it.
I have to get back. Honestly, I didn't bring materials about our international global program. I would have to get back to you that. I'm not trying to evade it. It's just not something that I thought was a topic of the committee meeting.
Well, I hope you would, because we have laws in this country that permit or prohibit us from sending money to places where we have sanctions on, and if Planned Parenthood is doing that, I would imagine that would be something that would concern you, would it not?
We certainly comply with all the laws, both globally and domestically, and that's why I commit to you. I will get information. We'll work with the committee to get information about the Congo.
Fair enough. I have a question. As a former pastor, 15 years in a couple large churches, there are many times where we counseled women at different ages, various ages, for different things that we're going through. Sometimes 15, 20, 25 years later, after going through an abortion, there was still some struggle there. I don't disparage these women for making tough choices. As you've talked about, many have come from underprivileged communities, didn't even feel like they had options. But of the $500 million of the taxpayers' money that goes to your organization, how much of that is set aside to offer counseling to some of those women who are still struggling with that issue?
Well, we don't, this is what it's really hard to explain to you, because I feel like we're talking past each other. We don't get a big check from the federal government. We're reimbursed for direct services, but they're all family planning, STD testing, well-women visits. I will say though, where one area I think you and I might agree, I would love in this country if we would fully fund, for Planned Parenthood or anywhere else, comprehensive counseling services for women on a whole host of issues. It is very underfunded, and it is really important to us as well, because we do counseling with women every single day.
I understand that, and I agree that there are some legitimate services offered, but this is something that I saw for 15 years. So of the $1.3 billion in revenue, even if it doesn't come from taxpayers, how much of that is set aside to offer these services of women who are seeking counseling?
We counsel, I don't know how, I could get the numbers for you. We counsel women and young people and men every single day at Planned Parenthood health centers all across the country, and most of it, as you probably know, is uncompensated care.
Well, I look at your numbers, and I would tell you this, it is amazing as far as the amount of revenue that exists, and that's why I wanted to talk a little bit about how much you're sending overseas. But I do have one final question. This is a big if there is proven to be criminal activity through an investigation, would you have any problem redirecting the $500 million or the $60 million of the 20% that's not Medicaid? Would you have any problem redirecting that to other women's health care organizations who are offering genuine health care?
Well, I'm not going to answer to a hypothetical, and again, we follow all the laws at Planned Parenthood. The health and safety of our patients is our #1 concern. If there is any issue ever, the state or local, national level, we will address it, and we do so swiftly, and we always have.
Thank you, Ms. Richards. I yield back.
Thank you. Now I'll recognize the gentlewoman from the Virgin Islands, Ms. Plaskett, for 5 minutes.
Thank you, Mr. Chair and Ranking Member Mr. Cummings. Thank you, Ms. Richards, for being here for the inordinate amount of time that you have. And I reiterate so much of what my colleagues here on this side of the aisle have said regarding this hearing and some of the concerns. You and your office know that I vocalized to you privately the fact that I'm displeased that Planned Parenthood is not present in my own district in the Virgin Islands or in any of the territories which have approximately 4 million people. And the reason I'm displeased about that is because I know the good work that Planned Parenthood does in preventative health towards women, with the Virgin Islands having 141 unplanned teen pregnancies per 1,000 when the national rate is 29 pregnancies per 1,000. I see how important the work that you guys do is to different areas. And, you know, the chairman has 7 clinics in his area in Utah. And, Mr. Chairman, we'd be glad to take any one of them in the Virgin Islands to be able to support women's health and the work that you do, knowing that 78% of those 7 clinics are in rural areas. And I know that this committee is searching for truth, and that's the purpose of the Oversight and Government Reform Committee. And I believe that we need to do that in a neutral and even-handed manner that reflects the integrity of this committee, which is why I think that this is a premature committee hearing, if not the fact that the other side, the individual that the minority has requested to be here, Mr. Daliaden, is not here. And while I understand that Mr. Daliaden has had restrictions on the videos being produced, he has not produced one document that has been requested by this committee from either side. Ms. Richards, do you know how many documents, how many pages of documents Planned Parenthood has produced for this committee?
Will the gentlewoman yield?
No, not at this time, sir. Afterwards, I will leave you some time.
Well, I know thousands and thousands of pages of documents.
I think it's 20,000 pages. And I know that the ranking member Cummings has sent a request for documents, and the chairman, Chaffetz, and Representative Jordan have sent their own request for documents. And a subpoena was issued, and it has not. Not one page of documents. Although I understand that from the testimony that the videos were, in fact, there was a question regarding that. And so, Ms. Richards, I want to ask you some questions since we only have Planned Parenthood here, and we only have your documents that we're able to put up and put up on screens and for you to be questioned about, not the other side, which as an attorney is a little problematic for me to be able to get to the truth if I don't see both sides of the evidence being presented to me. I understand that there are several states that have launched investigations against Planned Parenthood. Is that correct?
Well, there have been a variety of, I mean, we're constantly being overseeing our healthcare services. And yes, I think as a result of this recent campaign, there have been various state
and I understand that several of those states have cleared Planned Parenthood of any wrongdoing.
That's correct. That's correct.
And that there has not been produced any credible evidence that your organization has broken a single law. Is that correct?
I believe that's true.
And however, there's plenty of evidence that Mr. Daliaden and his associates have violated both federal and state laws. One example is his group obtaining tax-exempt status and apparently solicited charitable contributions under false pretense. Ms. Richards, are you aware that the Center for Medical Progress obtained a 501c3 status as, I quote, a biomedicine or bioengineering organization?
Well, all I know is what I've read in the paper about the organization.
And that, in fact, is a fake organization that filed official paperwork with the state of California to create a sham tissue procurement company called Biomax Procurement Services, LLC. Ms. Richards, as far as I know, illegally filing false paperwork with a state agency it's illegal and against the law, right?
It may be. I don't know. And I know there's a lawsuit now pending, and I think the Attorney General of California has indicated that there will be an investigation.
And so for me, for us to have this discussion with you without having the balance of the other side becomes problematic. Mr. Chairman, did you want to say something at this point?
Yes, I thank the gentlewoman for yielding that she made a suggestion that Mr. Daliaden had not been responsive to our inquiries. That's not true. We issued a subpoena, responded within the time. That package that arrived has not been opened. It's in our safe. He's unable to provide all of the documents given that there is a temporary restraining order. We understand that. House counsel's involved. Mr. Cummings and I evidently agree on this point that we're trying to get all of that information. But to suggest that he was non-responsive is simply not true because he did respond within the time allocated under the subpoena.
Well, it's my position, Mr. Chairman, that until you're able to open all of those documents and receive all of them, and we're able to balance them against the documents, the 20,000 pages of documents produced by Planned Parenthood, that this is an unfair hearing and that we're not getting
Will the
balance
gentlewoman
and able
yield?
to do that.
I agree that we need all the information. That's why Mr. Deladian was not invited to this hearing. The subject is exactly what I said in my opening comments and statements, of which many members have inquired about. It's the funding component. We did not title this hearing as a hearing on the videos. It caused some controversy, but we have, in the essence of time, some legitimate discussion about a continuing resolution and ongoing funding for Planned Parenthood, and we've laid that out. But my comments were not about the video, it was about the funding. That's where my concern lies.
Mr.
And
Chairman.
we will get to, hopefully, see all of those videos, but we've got to get past the restraining order that has been put in place by a judge in California.
Mr. Chairman, if we're going to discuss funding, and knowing that members of Congress can sit here and ask questions that run the gamut, and that funding question is related to those videos, which are the genesis of the question of whether to defund, then I think it's a little naive of us to think that that discussion can be done in a vacuum without the videos and the other documents from the other side. I think that my time is up.
Would the gentleman yield with the chairman's indulgence? In fairness to the gentlelady, I'm looking at the memorandum from the majority, and it talks about background for this hearing. And the first sentence under background says, recently released videos demonstrate Planned Parenthood Federation of America participates in transactions involving transferring fetal tissue for remuneration. And then it goes on. But let me just very briefly, so that the record is clear. The gentlelady referred to documents that we had not received. And again, I'd like to briefly clarify one point on the record because it is important for the committee members to understand, and I'll be very brief. On Friday afternoon, the Republican staff informed Democratic staff that Mr. Deliden sent them a package, a FedEx box, but they said that they did not want to open it until this week. We thought this was strange because if the Republicans delayed opening this package, members would not have had enough time to review whatever was inside before today's hearing. So our staff also made it clear that if the Republicans wanted to use any of this material at today's hearing, it should be open immediately on Friday, so we could begin to reviewing it as soon as possible through the weekend. But the Republican staff told us that they wanted to just keep the box closed. They said they would not open it and they would not use it at the hearing. So, as of this moment, we still do not know for sure what is inside that box from Mr. Deliden. However, we did receive a copy of minutes from a recent hearing in a lawsuit in California where Mr. Deliden's attorneys apparently told the court in that case that they delivered additional video footage to our committee, so even more footage that Mr. Deliden cut from the videos he's released publicly. So we want to open the package. We want members to have equal access to the videos that are apparently inside, and we definitely want to see what the other footage Mr. Deliden was concealing from the public. And I'll yield back.
Yeah, I want to see all the videos too. That's why we issued a subpoena. I wish you all had supported us when we issued it.
Again, Mr. Chairman, I've said it before, and I don't want to.
I'm glad to have your support.
I don't want to belabor it. No, it's not now. We've supported, and I can show you the documents to show you that we have asked that we get all of the tapes. And I will certainly, if you give me a few minutes while others are asking questions, I'll give you the very documents that we sent you showing that. Okay.
All right, we're going to go now to the gentleman from South Carolina, Mr. Mulvaney, for 5 minutes.
I thank the chairman, and I'll try and make my Democrat colleagues happy and ask funding questions that have nothing to do with the videos. How about that? Which is more important to you, Ms. Richards, actually providing women's health care services or lobbying?
Well, I think these two things go hand in hand, and certainly what we have learned over the years is that in order to be able to provide health care services to women, you have to also be able to advocate, particularly for women who are underserved. So I think the two things actually go hand in hand.
Fair enough. You spent $21 million on lobbying in the last couple of years. You spent $0 on mammograms. Why is that?
Well, I think we've discussed mammograms repeatedly and how women's health care works. So when I go to my doctor, I get a breast exam.
Referral, I get that. Why don't you do them?
We refer to
Why don't you do them?
Well, we're not a radiological clinic, and I actually don't think that's
Why not? That's a woman's service.
Well, I guess we could take it up, but we never have provided mammograms because we work in concert with folks who do provide radiological services.
You're
We
aware,
do
by
a
the
number
way,
of breast exams.
You're aware, by the way, there's people running for president saying that you do provide mammograms, and that's not accurate, is it?
Well, there are a number of people running for president saying a lot of things that
On that
I
side.
can't certainly.
You said earlier that you don't make any money from federal funds, right? You don't make any profit off the federal funds. Is that correct?
So Planned Parenthood is a national office. We have one source of federal funding right now. It's a $21,000 roughly grant for a birth control clinical trial where we're actually reimbursed for costs alone, and that's the only source of federal resources that come to the national office. So we couldn't make a profit off that.
Where's the $532 million going?
So Medicaid and Title X.
So when you said you don't make any money off the federal funds, you were talking about the parent, not about your operations.
I was trying to explain that the national office, and then we have 59 affiliates. We have 650 to 700 health centers that provide healthcare services.
Is it your testimony that none of those make any profit off of federal funds?
Well, I would have to, they're all reimbursed for services that they provide, and my experience has been,
right?
Excuse me?
That provides a profit. You get reimbursed for services.
Well, we're a nonprofit, so
You're a nonprofit that made $127 million last year.
We didn't make money. We don't make money. We actually reinvest money in healthcare services and education and
okay, so good.
a lot of other things.
Let's talk about that.
I wanted to answer your
I want to follow up on that
question.
question. Now let's go on to this one. You just mentioned that you don't make money, but you had revenues in excess of your expenses of $127 million last year. That's right. That's your testimony.
We
That's your
raised-
numbers. Right. So here's my question. I'm going to get to the question if you let me. Where does the money go? Where does that $127 million go?
So like any organization of our size and scale, a lot of our resources are in what is a board-designated endowment or reserve. We are a 99-year-old organization, and so we've built our endowment. But also, I'm investing.
So you retain those earnings. In the private sense, you would retain those, or you put them in the bank.
Well, I hope they're in the bank and not just laying around, but I certainly, in addition to that, so some are in reserves, and the other is I've just invested in expanding healthcare services and building new clinics in a variety of states across the country.
How is
That's
that not an
paid
expense?
for. Excuse me?
How is that not an expense?
Well, it is an expense.
No, but your books reflect revenues in excess of expenses of $127 million.
I'm sorry, they're not all out the door, but I've made commitments to opening up new health centers in New Orleans, in Dallas, in other states in the South, we're opening in other states that I won't mention here probably because it would just cause more attention.
Okay, so let's say that money goes towards expanding their service. One of the proposals here, Ms. Richards, is to defund Planned Parenthood, which includes taking $60 million, roughly $60 million away from what you get out of discretionary funding. If we took $60 million away from you could still perform every single service that you gave last year, can't you?
I can't say that because those.
Oh, you made 120. You said you have revenues in excess of expenses of 127 million. Now you told me what you do with 127 million. You're spending it, you're investing it, you're expanding. I get that. But if you had $60 million less last year, you could have provided every single service to every single woman that you did last year.
Well, I constantly raise money to expand services to the patients that look to us, and so.
And God bless
I
you.
don't.
And I think that's great. But answer my question, please. You could have provided every single service that you did to every single woman last year if you did not get a penny from the discretionary fund from the United States Congress.
I actually disagree, and there's no way I could agree to that. These are services that are spread out all across the country, and I can't possibly account for how each dollar that I raise, some of which is committed to other services and expansion of services, could simply replace federal dollars.
Not expansions of service. I'm talking about services you actually provided. You would have had $67 million.
Well, we're expanding services beyond what we already provide.
Got that. Not my question. My question is, if we had not funded you last year, you still would have been able to provide the services. And I think the answer is unequivocally yes. You might not have been able to expand your services, but every single woman that walked into every single clinic would have been served if you had not received that money from Congress. Thank you, Mr. Chairman.
I disagree, but.
And we're just trying to figure out why you would disagree with that. Revenues would still exceed expenses, even with $60 million less.
So do you want me to start talking? Are we now having this conversation? I'm sorry, I wasn't sure if we're.
Yeah.
finishing this?
Sure.
So I raise money every single day to expand services and education services to people in America. That's what we do at Planned Parenthood. And like any other nonprofit, we reserve money for all kinds of services that need to be expanded, assistance that needs to be provided, and that's what we do with our money. We're a nonprofit. We don't do anything else with our money other than put it back into the services, the education, and sometimes the advocacy that we provide.
We'll now recognize the gentlewoman from New Mexico, Ms. Lujan Grisham, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Ms. Richards. And if this committee is going to undertake how Medicaid money is used and not used by every health care provider in every state and every local government in the United States, it might be a very interesting hearing about how we can assure that the Medicaid funds that are not reaching so many still, even with the progress of the Affordable Care Act, so many women and so many families, that would be a hearing that I think would be well worth having. I'm going to go back to both the funding aspects here, the unintended consequences, and really appreciate the comments of all of my colleagues, but Mr. Welch and Mr. Boyle. I served as the New Mexico Secretary of Health, and one of my challenges was certainly to deal with teen pregnancy, but to also to make sure that we had the right partnerships and viable access in a public health system where women and their families could get access to health care services that were of high quality and services that they trust. I can tell you something you already know, that without Planned Parenthood, we could not meet those access points, and quite frankly, even in the public health system, there are many women, particularly in rural and frontier areas of the state, who A, did not have access or would absolutely under no circumstances choose that access, where I'd like to tell you that our record about prevention and preventing pregnancy was better in the public health system. And that was in a world where we didn't have the 2008 budget issues, where our state now is not putting money into public health or expanding public health or working on women's health care. And without the Affordable Care Act, our rural hospitals and community health centers would all but be closed. And I will tell you that we now have the highest teen pregnancy rate in the country, with efforts at looking at what we can do for 15-year-olds to prevent the second and third pregnancy. Women need and deserve unfettered, high-quality, confidential access to comprehensive health services. And I'm hearing from hundreds of constituents, and I also know that thousands of New Mexico women and their families will not have access to these services because it is all connected, and even if it wasn't, would still want them to have the choices that they make that are right for them. But with all of the funding issues that we debate in this Congress, I know unequivocally that they don't have access in many of the places that they should, and under the Equal Protection Clause, they certainly ought to with Medicaid funding. Can you talk a little bit more about what states like New Mexico, with these high teen pregnancy rates, without public health access, without those rural access points, where would those 21,000 women go?
Well, I thank you for your service in the public health arena and for your question. I do think it's incredibly important that we're constantly looking at new ways to help particularly young people access information and services. And it sort of goes back to the chairman's question maybe earlier, which is one of the things we do at Planned Parenthood, in addition to providing Medicaid family planning services and other, is we now run education programs all across the country and through the web that have an average of 6 million visitors every single month, and visited by young people and by their families, English and in Spanish, because many people don't have access to adequate sex education in their communities. In addition, we are looking at more ways to provide birth control through virtually, so that actually you can order it online and don't have to be in a clinic, because for many rural Americans, it's very difficult to access a family planning provider in your community. So those are the kinds of things.
Not there. I have a pastor in my district who's let me know that he refers women to Planned Parenthood because he knows that there aren't the right community access points. And I know it's been touched on in this committee, but I have personal experience and know many of my constituents in their 20s and 30s and 40s who, without the comprehensive health care services would have died from cervical cancer. And I know exactly how important, again, in a state that has higher per capita averages in many of these cancer areas for these populations, and particularly for minority populations, that we want to do a much better job investing in comprehensive health, simply do not have it. And the notion that we would continue to discriminate against those populations by not providing adequate federal funding and access makes no sense if what we're trying to do is to maintain my choice about my high-quality confidential provider. Thank you, Ms. Richards, for being here today. I appreciate your testimony.
Thanks for letting me be here. Thank you.
Thank you. We have, members are advised we have 2 votes on the floor. There are approximately 8 minutes left in this first previous question vote. It's the intention of the chair to recognize Mr. Heiss for his 5 minutes of questioning. Then we're going to go to recess. Then we're going to have to come back. We thought we could get through it, but we still have a number of members who have questions. So we'll now recognize Mr. Heiss for 5 minutes. Then we'll go into recess and we'll reconvene after the votes.
Thank you, Mr. Chairman. Ms. Richards, just a point of clarification. It's already been established that Planned Parenthood serves a lot of underprivileged people. And I just want to be clear in your testimony, you stated that it is significantly more difficult for individuals on Medicaid to access a provider as opposed to someone with a private insurance, because so many providers now are not accepting Medicaid. Is that correct?
Medicaid patients, it really varies across the country, but
across the
certainly
board?
there are some states where it's very difficult.
And that's one reason that you would say that Planned Parenthood is needed, because there's a gap there. Is that correct?
Well, I think I think we have tried to demonstrate that we are an important provider of Medicaid services to a lot of folks in this country.
But particularly the underprivileged and
well, that's who, I guess by definition, yes, that's
all right.
who's
So
on Medicaid.
you also said in your testimony that the Government Accountability Office found that about 2/3 of the states are challenged now recruiting OBGYNs because of the difficulty in ensuring provider participation in Medicaid, and that, according to the CBO, this again is in your testimony, that by next year, Obamacare is expected to reduce the uninsured, and nearly half of those are going to be on Medicaid. So from these testimonies or these statements in your testimony, is Medicaid, in your opinion, a substandard insurance?
In my opinion, is it no?
Is it an inferior product?
Well, I'm not sure. I'm not exactly sure how to answer that. I think it's important that Medicaid
Well, this is according to your testimony, and I just want to know.
No, I didn't. I don't think I said that, so I just want to make sure I'm clear what you're asking. I think that it's important that Medicaid patients be able to get the same kind of quality of care as other
But you said
insured
they
people.
can't. They're not able to because so many providers are not. Let's go on to some other things. I was just curious, and those were some questions that I had jotted down. It seems to me that there's a question mark there. You praise it on one end, Medicaid, and then
very important.
say it's a problem on the other,
No,
and that's why.
It's not, so I hope I didn't misstate that. I don't think Medicaid is a problem. I think the challenge is because the reimbursement rates are very, very low in many states, there are not enough doctors and healthcare providers that will take new Medicaid patients. That's something everyone struggles with.
Let's go further. I do have some other questions. We've also established today that there has been some excess revenue, as you describe it, other than saying profit, excess revenue, nearly $750 million in the last 10 years, $127 million last year. We can break that down in a number of different ways. And yet at the same time, the dramatic reduction in prenatal care, preventive services, cancer screening, and so forth. And do you have any idea, by the way, how many Planned Parenthood clinics have closed over the last 10 years?
I don't have those exact numbers, and you're referring to a lot of things. I'd have to go back and look at charts where I think we've addressed, and although I know not everyone is here for all of it, why some women's health care services aren't needed on an annual basis anymore. But many of our Planned Parenthood health centers have merged to be more efficient. We were started 99 years ago, and I will be candid, there's not always total efficiency.
Okay, well, let me go on. There's been over 100 that have closed just over the last.
Or merged, well, I would say, or
closed
merged.
and merged, whatever. But the bottom line is, you stated just a few moments ago that this 127 million, $750 million over the last 10 years, that you're largely holding it and using it for investment purposes. Why is it on the taxpayer's hook to provide for your investments in expansion when you are declining your services and clinics are closing?
I don't think the federal government isn't investing in our expansion. In fact, the federal government,
you've got 127 million over the last year that's excess.
That was none of that is federal dollars. I'm sorry, that's all raised by
private. All right, so we have 60 million that are federal dollars that comes through the discretionary fund. Why does the taxpayers need to be providing 60 million when you've got 127 million a year? I mean, I'm just going back to the question already asked. I'm trying to find, why is the taxpayer responsible for your expansion?
I'm not holding the taxpayers responsible for our expansion. In fact, the money that is paid for by the federal government through Medicaid, through Title X, through CDC grants, through HIV/AIDS programs, all pay for services directly provided to patients. And there's strict accountability, and we are accountable by HHS, looks at all the Medicaid payments. So we're grateful for the opportunity to serve patients who come into us on those programs. I think we provide very high quality, and that's why patients continue to come to us. And I think patients, regardless of whether they're on Medicaid or not, should have the option to go to the healthcare provider of their choice.
Thank you, Mr. Chairman.
Thank the gentleman. The committee will now stand in recess and reconvene no sooner than 2 p.m., but will be beholden to the conclusion of these votes. Committee stands in recess. Committee on Oversight and Government Reform will come to order, and we will resume our hearing regarding Planned Parenthood. We are now going to recognize, if the gentlewoman would need her to change. If we would, we'll now recognize the gentleman from Missouri, Mr. Clay, for 5 minutes.
Ms. Richards, welcome, and thank you for your patience for being here so long. Let me start with the point that a lot of Republicans have relied on these doctored videos to accuse Planned Parenthood physicians of violating federal laws. Just yesterday, the Missouri Attorney General, Chris Koster, just completed his investigation of Planned Parenthood and found no wrongdoing. However, I want to walk through some of these accusations and ask you to give us the facts. Just as a preliminary matter, does Planned Parenthood receive any federal funding for its tissue donation program?
No, not that I'm aware of.
Okay, let me ask about the accusation that physicians are illegally altering abortion methods to harvest fetal tissue in violation of federal law. First, here's what the law says. Doctors must certify, and I quote, no alteration of the timing, method, or procedures used to terminate the pregnancy was made solely for the purposes of obtaining tissue. This provision applies to federally funded research involving the transplantation of human fetal tissue for the therapeutic purposes. This has been confirmed by the Department of Health and Human Services, which wrote that the department, and I quote, has not funded or conducted this specific type of research in recent years. So even though this law does not apply to Planned Parenthood affiliates, you have still issued guidance that is consistent with the law. Is that right?
That's correct. So just to be perfectly clear, the federal law you're citing doesn't apply to Planned Parenthood because it, as you said, it only applies to donations related to transplantation research funded by the NIH. One other thing, Congressman Clay, actually I would like to mention that when all of this came up, I actually wrote to the NIH and said, if it's time to review the way fetal tissue research is done in this country, we welcome that. It's a very small part, obviously, of what we do. Only 1% of our health centers even allow for tissue donation. But it seems that it would be an appropriate forum for biomedical ethicists and researchers and doctors to do that, and we welcome that if the NIH chooses to do so.
Wonderful, wonderful. Okay, let's turn to these accusations. David DeLayden and the Republicans accused Planned Parenthood physicians of changing the timing, method, and procedure of abortion solely for the purpose of obtaining fetal tissue. So let me ask you directly, do Planned Parenthood physicians alter the timing, method, or procedure of an abortion solely for the purpose of obtaining fetal tissue for research in violation of federal law?
Well, first, just to go back, as we've established, federal law doesn't apply, and yet our own standards and guidelines go above and beyond what's required. I have spoken with our chief medical officer, and she assures me that she knows of no instance where the method or the procedure or the timing of an abortion was altered in any way in order to facilitate what is the patient's desire to donate fetal tissue for fetal tissue research.
Let me ask you, when physicians do make clinical adjustments during the course of the procedure, why would they do that and how does that work?
Well, I'm not a doctor, so I can't speak to everything that doctors do, but I do know that our number one goal at Planned Parenthood is the health and safety of our patients. And so certainly our doctor's number one goal is to make sure that if it is an abortion patient, that they have a successful procedure. And I know from talking to doctors all across the country, long before any of this happened, that doctors do all kinds of things, as do all surgeons, I assume, make decisions in the middle of procedures to ensure a good outcome.
Let's move to a different accusation, which is that women are not consenting to participate in these tissue donation programs. Can you speak to that women may not be consenting to donating the fetal tissue?
Women are fully consenting, and they consent at Planned Parenthood certainly prior to an abortion. And one of the interesting things that has happened, in part as a result, I think, of all of the press, is that there are more and more women asking if they could actually donate fetal tissue because they understand the importance of the research that's done. But again, we only have 2 affiliates now who are able to, can help women who want to make a fetal tissue donation.
Thank you.
Gentleman's time has expired.
Thank you.
The chair now recognizes the gentleman from Oklahoma, Mr. Russell.
Thank you, Madam Chairman. And thank you, Ms. Richards, for being here today. How much total revenue collected or reimbursed for Planned Parenthood and its affiliates comes from abortion services?
I believe we've provided all of our financial information. I don't have that number.
Do you have a ballpark?
No, I don't. But again, we've provided, I know there was some back and forth about this, but I just verified it on the break. We've provided all of the 990s, not only for the national organization, but our 59 affiliates, and I believe their audited financial statements.
I guess if we were to extrapolate from the Planned Parenthood website of the cost of an abortion, the average cost, or of an abortion pill, it would be at $1,500 for the service of abortion or $800 for the pill. If you multiply that times 327,000, that would come somewhere between 40% or 22% of a figure. Regardless, it's 491 million down to 261 million just from the ballpark figures we see on Planned Parenthood's website.
And I have to, I'm sorry to interrupt, but actually that's not accurate, but in any case.
Well, then would you be willing to provide us what the accurate figure is, and when could you provide that to us?
Well, what was inaccurate is, I think, what you reported in terms of what the cost of an abortion. Obviously, it varies state to state, so I can't say, but I think your number was high.
Well, we would await the accurate figures, and when would you provide those to us?
I've said to the chair, and we have been abundantly cooperative to this committee. We've provided thousands and thousands of pages of documents, and I'm happy to work with the committee and the staff and with my team to provide other information that you need.
And I appreciate that. We'll continue on. Absent federal funding, what effects specifically would it have on the organization's ability to provide abortion services?
I'm sorry, can you restate your question? I just don't think I
Absent
understood it.
federal funding, what specifically would it have on the organization's ability to provide abortion services?
Well, okay, I hope I'm answering your question correctly. No money, no federal dollars go to Planned Parenthood or other hospitals or other healthcare providers
So it
that
would
provide
have no
abortion
impact,
services.
is that your answer?
No impact on what? I guess that's
on
what
abortion services.
If we were not reimbursed for family planning, for preventive care.
No, I'm asking specifically, absent federal funding, what specific impact would it have on abortion services?
I can't think of a specific impact. I'm just trying to make sure I really am trying to be responsive
No,
to understand your question.
And I can see that. Thank
Okay.
you. Can federal funds be used for abortion equipment?
Federal funds are only, in my understanding, and if there's something there may be something I'm unaware of, but federal funds can only be used for abortion services in very specific instances, which we talked about earlier, which is if a woman has been raped, if she's the victim of incest, or if it's the life of the mother.
I'm curious on the equipment, on the salaries, cleaning services, rent and maintenance of facilities. What about that?
So let me just, on the abortion services and on federal funding for abortion services, this is actually done through the states. That's where Medicaid funds come through, and I can get I mean, certainly we could look at
Okay.
any specifics on that, but
we
that's,
would
that is
like that if you could
oversight
answer that,
by,
'cause I
well,
realize
it's
in
the
the
federal
time
government,
we
though,
have-
that actually is making those decisions.
Well, thank you. And
It's not, I mean, just, it's
for the
not Planned
record,
Parenthood.
Mr. Chairman, we've heard testimony today that 2.7 million receive services in the last reported year. That number is actually over 3 million when you add the 327,000 aborted children to that figure. For the record, 2.7 million receive services and 327,000 receive a legal termination with no right to choose life. 3 of my 5 children are adopted. It is my firm belief, and the financial evidence substantiates, that Planned Parenthood clearly does not need taxpayer funding to survive. We can carve up a child and call it a choice. We can destroy human life and call it health care. We can make the killing of children legal and pretend it is beneficial. We can cover acts of barbarity with the veneer of civility, but we cannot escape our accountability before the Creator of life. And with that, Madam Chairman, I yield back my time.
Gentleman yields back. The chair now recognizes the gentleman from Pennsylvania, Mr. Cartwright.
Thank you. Thank you, Madam Chair. And Ms. Richards, I want to thank you for being here today. I want to ask about Planned Parenthood's federal funding, since that's supposed to be the topic of today's hearing. What we're hearing is that Planned Parenthood receives about $500 million in federal funding every year, and it's easy to see why you hear that figure a lot, because it's an awful lot of money. And it seems like, I mean, the way you hear it, it sounds like Planned Parenthood receives a big check, big cash payment every year. But I want to break down the numbers. According to the data compiled by the GAO, something like 80% of Planned Parenthood's government-related revenue in 2012, about $400 million, came from Medicaid reimbursements. I think that's the point you've been trying to make today, is that it comes in the form of Medicaid reimbursements through the states for activities such as cancer screenings and wellness exams. Ms. Richards, first off, is that figure correct, around 80% to the best of your knowledge?
I think that to the best of my knowledge, it is correct. We, about 1.6 million of our patients in a year are covered by some kind of federal program, Title X, or they're Medicaid patients, or there's a few other programs that we work on HIV/AIDS programs and the like.
And so is that figure fairly consistent with more recent years?
Yes, and also one thing I just want to make sure is clear, it's not all federal funds. A lot of state funds are combined in that figure, and I don't know the exact breakdown.
Fair enough.
So it's just not all federal dollars is all I meant to say.
But what these numbers really mean is that Planned Parenthood affiliates provide a massive number of health care services to Medicaid patients, and then they're reimbursed on a fee-for-service basis.
That's exactly correct.
Fair statement?
And I think proudly we provide really, really good health care for Medicaid patients, and we're proud of that.
Okay. Well, I come from a district that has a lot of rural territory in northeastern Pennsylvania.
Mm-hmm.
We have an awful lot of Medicaid-eligible patients.
Yes.
So it's an issue of concern to me. Medicaid patients are primarily people who are poor, elderly, or have disabilities. Isn't that right?
I don't know the breakdown of all Medicaid patients, and certainly don't know for your area of Pennsylvania. I do know how many patients we see in Pennsylvania.
Just in general, Medicaid patients, stay with me here.
Okay.
Medicaid patients tend to be poor, elderly, or have disabilities, don't they, in general?
Again, I'm just speaking, I only know of the folks we serve, so I can't speak about Medicaid patients more broadly. We don't serve many elderly Medicaid patients. Primarily, we serve women between the ages of 18 and 44.
Of course, that's true.
Okay.
And many of Planned Parenthood's Medicaid patients come from medically underserved communities, right?
That's correct.
And that's why the $500 million figure gets thrown around so much. That's why that's so misleading, because this is not an appropriated amount from discretionary spending. It is reimbursements for fee-for-service treatment. And like other medical providers, Planned Parenthood is reimbursed for the health care it provides to these patients, and that's generally the way health care insurance works anyway, right?
That's exactly right. It's just a different insurance program.
In fact, we rely on providers to take in these patients, especially since Medicaid generally reimburses at a lower rate than private insurance.
That's correct, and I think it's really important because in so many states, as we've talked about earlier, there are not that many healthcare providers that will take Medicaid patients.
In fact, I think Dr. Gosar made that point. Medicaid reimburses rather poorly.
It does, although we're really proud. I was just looking at your state of Pennsylvania. We see 108,000 patients in the state of Pennsylvania, and many of them are in rural communities.
Well, so when we hear talk about defunding Planned Parenthood, a big part of that is excluding Planned Parenthood affiliates from Medicaid. Isn't that right?
Correct. Essentially, and that's what is important. I'm so glad you made this point because we can't make it strongly enough. It's, as you said, we don't get an appropriate amount of money. This would actually, what Congress is proposing doing, would deny people on Medicaid the ability to go to the provider of their choice, and many of them do choose Planned Parenthood for a whole host of reasons.
Thank you for being here, Ms. Richards. I yield back.
Thank you.
I thank the gentleman from Georgia, Mr. Carter, is recognized. Thank you, Mr. Chairman. Ms. Richards, you were kind enough to provide this committee with a list of the salaries and the compensation of the officers of Planned Parenthood. That is correct and up to date. Is that right?
I'm sure it is if we provided it.
Okay. Well, thank you. So, I'm looking at this and I'm seeing an employee at Planned Parenthood's affiliate in Minnesota, North Dakota, and South Dakota was paid $459,827 in 2013. Is that correct?
I don't have the figures in front of me.
What
I
you
do happen to know that affiliate is this is a woman who's been a healthcare professional for decades.
At $459,000. And it is correct that you were compensated $590,000 in 2013. Is that correct?
Well, I tried to address this earlier.
I understand.
Would you like, I'm sorry, I was
But I'm just, yes or no, is that correct?
$520,000 is my annual salary, and there was a benefit that was accrued to me over several years.
So $590,000 was your compensation in 2013.
In that year, and it's set by the board of directors, and it's important for me.
All I need to know is yes or no.
No federal funds go to my salary.
I understand, but $590,000. $590,000 was what you were compensated in 2013, according to what you provided this committee with. Correct? Yes. That is what.
Your Honor, you're answering your own question. Okay. I think I've answered the question.
Well, let me ask you about the travel for Planned Parenthood. Planned Parenthood spent over $5 million on travel in 2013. That's almost $14,000 a day.
Well,
was that first class or was any of it chartered jet?
Boy, that would be nice. I've never. I don't fly first class.
$14,000 a day.
We have 8 million supporters in this country. We provide health care to 2.7 million people. We provide sex education to 1.5 million people.
Is that number correct? And $14,000 a day. Is that
I don't
correct?
have the figures.
Okay, well, that's what you provided.
I'm happy to look.
I just want to make sure.
I'm happy to look at them.
But can you provide this committee? Can you provide this committee with the records that show the modes of travel that you have taken, whether they've been first class or whether they've been chartered jet? Can you break down that travel for us?
I will work with the committee staff to provide whatever we can on the questions that have been asked.
We appreciate that very much. Let me ask you something.
Although I will say for the record, I do not travel first class.
Neither do I, but I don't spend $14,000 a day either.
Well, I have anyway.
Nevertheless, let me ask you, you've made the claim that many patients wouldn't have timely access to basic reproductive health care if it weren't for the services of Planned Parenthood. Yet, the U.S. Department of Health and Human Services in 2015 said that there are almost 9,700 health care service delivery sites and over 4,000 rural health clinics, including over 1,200 federally qualified health centers operating over 9,000 sites in the United States. How many clinics does Planned Parenthood operate? I believe earlier you said 650 to 700?
650 and 700, depending.
But yet, if that 650 to 700 were to go away, these patients wouldn't have access to health care.
Well, I mean, I'm looking at the CBO report, which is the Congressional Budget Office, just came out with a report that if Planned Parenthood, if women were unable to go to Planned Parenthood, Medicaid patients or Title X patients, 390,000 women would immediately lose health care next year.
The problem
I'm reporting back what the government
The problem I have with that is that the Obama administration reports that there are over 13,000 publicly supported health care alternatives in the United States. Have you seen that? Are you aware of that?
I haven't seen that.
That's what the Obama administration is telling us. Yet, so that's almost 8 times as many as Planned Parenthood has. And out of those clinics, I mean, we've got almost 20, excuse me, I misspoke, over 20 federally funded clinics as opposed to every Planned Parenthood. Yet those federally funded clinics, they don't have $100 million endowments. They don't have $70 million Manhattan condos. They don't spend hundreds of thousands of dollars on Grammy-winning performers performing at their galas. They don't do any of those things, yet they are able to provide services, needed services to women. Why is it that Planned Parenthood has got to have that in order to provide the same services? Do you believe, yes or no, do you believe that they have to have that?
Well,
it's yes or no, that's all it is.
With all respect, that wasn't really a question. I would say I really stand by the fact that we provide health care to many, many women in this country who have no other options.
The question, Ms. Richards, the question was, have you got to have that in order to provide health care to women?
We provide.
These other clinics don't have it, and they provide it.
Well, I'm not going to speak to every other hospital, health care center, and FQHC in the country.
Provide health care to women?
I think we provide excellent health care to women in this country. And I think the point here...
That's not the question. The question is, do you have to have a $100 million endowment, $70 million condos?
I don't know what you're speaking about, but with respect, I think it's important that the question here is, do low-income women in this country have the right to choose wherever they want to go to for health care? And 2.7 million of them choose Planned Parenthood.
Why don't you let them go to one of those $70 million condos in Manhattan and get care?
Young lady from Texas is recognized.
Mr. Chairman, thank you so very much for the courtesies extended. Let me thank the chairman of the full committee for his courtesies, and to Mr. Cummings, certainly for his courtesies as well, for my participation in this very vital hearing today. I am a member of the Judiciary Committee as well, and we held such a hearing some weeks ago, and so I can almost say deja vu. Let me thank Ms. Richards, first of all, as a fellow Texan, to thank her for the legacy of her family that has always been engaged in public service, and that's what I consider you and Planned Parenthood as doing. Coming from Texas, let me cite the Houston Planned Parenthood offices, of which I've been in and walked through and seen the clinics, and seen individuals who fell into my arms, indicating that without Planned Parenthood, they would not be able to, in fact, have health care. Let me ask you very quickly as my time goes, it may be as I've been listening this afternoon that we have been mixing more than apples and oranges. It might be apples and potatoes, because we're talking about abortion. And when I say that, many of these questions have come forward. And I just wanted to read this quote from a senator in Oklahoma in discussing Planned Parenthood. My focus is to try to deal with the life issue. Defunding Planned Parenthood is just a sideshow for the real event. Has this come to your attention, Ms. Richards, that many are talking about something that really has nothing to do with your federal funding?
Well, I do think it's been a bit of a theme, and I think that is one thing I'd like to say. It's important that I don't really believe that an organization, a healthcare provider, should be discriminated against for providing a legal service, whether it's Planned Parenthood or a local community hospital or anyone else.
Let me follow up as well and hold this up and ask unanimous consent to place it into the record. And let me cite for some of my colleagues, Ohio, 28 clinics, 80,000 patients, 66,000 on contraception, total on sexual transmitted diseases, 105,000. Texas, 38 clinics, 150,000 patients, and 108,000 on contraception and others dealing with sexually transmitted diseases. But if those clinics went away, then we're talking about 28 in a big state like Ohio, 38 in Texas, thousands of women losing access to health care. Is that not correct, Ms. Richards?
That's correct.
And are you familiar with the Texas cases which challenged or discussed the legislative initiatives in 2014, 2015 that were literally implode clinics in Texas, and the Supreme Court decision that ruled in 2014 and 2015. I think the United States Supreme Court, maybe based on Roe v. Wade, maybe based on the fact that abortion services, which are not part of the funding here, but in any event, just so my colleagues would know that, in my state of Texas, the state law would have cut off 75% of reproductive health care clinics. The Supreme Court indicated that the Texas law was unconstitutional, indicating that the separate work that you do, dealing with people's right to choose, is a lawful act and has nothing to do with federal funding. Is that correct?
I believe that's correct.
And the Supreme Court has indicated that abortion by law is not illegal in those cases.
And I know a lot of these are still on appeal. I do think, since we both come from Texas, I think it's important to know that when the state of Texas shut down the Texas Women's Health Program and to end Planned Parenthood's ability to serve women, there are 25% fewer women in Texas that are receiving care as a result. And so I think that's why it's so important that we don't ever put politics ahead of women's health.
Let me get these last two questions in. As a
Certainly.
member of the House Judiciary Committee, we deal a lot with the FBI, so does this committee as well. Let me just ask you about Mr. DeLayden's work. Is Mr. DeLayden a member of the Federal Bureau of Investigation, to your knowledge?
Well, not to my knowledge.
Is he an FBI agent, to your knowledge?
Not to my knowledge.
Is he a member of the Department of Justice?
I don't believe
Has
so.
the Health and Human Services ever investigated you per se about your Medicaid reimbursement, meaning something that you have not been able to answer or file another filing?
We follow all the laws at the state and federal level every day.
So Mr. DeLayden has been engaged in an investigation, has no authorization, is not a member of the FBI, which I would call dastardly and deceitful. So I'd ask you this question. Are you aware that Mr. DeLayden has pleaded the Fifth Amendment in some cases that he's engaged in?
I have read that in the paper.
Are you aware that it has been checked by RH Reality Check that Mr. DeLayden stole the identity of the president of the feminist club at Mr. DeLayden's high school? Have you heard that?
I've also read that in the paper.
And let me cite not you, but RH Realty Check. Would we then, Mr. Chairman, as I finish, would we then say that we're here today to speak about the facts? And therefore, are you saying on the record today that Planned Parenthood does not use any federal funding for anything that is not authorized under the laws of the United States of America?
Time of the
Can
gentleman
she answer that question?
Of course.
We follow all the laws at the state and federal level, and whenever we find issues, we take care of them and address them.
I thank the gentleman for his courtesy. I thank this committee for its courtesy. Thank you. I yield back.
I thank the gentleman. Gentleman from Wisconsin is recognized.
Thank you. A few questions. I'd just like to clear up some things. First of all, you talk about the percentage of women who are low income served by Planned Parenthood. I am under the impression that for defining income, if you have a younger person, a 21-year-old college student, or even a 16-year-old high school girl, that for the purpose of defining income, you leave out the mother's income. So, for example, if a billionaire's daughter who made $5,000 last year came to Planned Parenthood, she would be considered low income. Is that correct?
I would have to check on that. I don't know of any billionaires' daughters that are coming to Planned Parenthood, but I'm happy to look into that and to address your question.
Okay. I'm saying for the purpose of the family planning waiver, I think it's pretty well publicized that, you know, both high school kids, college kids, for the purpose of determining income, they look at they're considered a family of one despite living with parents. Is that true?
I'm happy to check on that. And
Okay.
I think a lot of high school or college women, they may, at that point, they don't have the resources of their parents, and a lot of young women do come to us because they need family planning but can't talk to their families.
Okay, the next question I have, when I look at cities around me that have a Planned Parenthood clinic, usually they're what by Wisconsin standards are medium-sized cities, $20,000, $30,000, $40,000. Usually in those cities, as a guy, I could go to many clinics locally that have all the machines that one would need. All of these clinics, as far as I know, take Medicaid dollars. So they, you know, you could go to any of those clinics to get any medical service you could. I guess what I'm getting at is, in my opinion, if Planned Parenthood disappeared tomorrow in those towns, there would still be 3 or 4 or 5 clinics or hospitals providing all the Medicare, all the medical care you would want, and quite frankly, providing superior care to people who are on Medicaid.
Well, I think we do provide superior medical care, but at any
I mean, I'm saying superior care in the sense that on Medicaid, without the deductibles and copays, it's usually better insurance than other people have. I guess what I'm saying is, it would seem to me if Planned Parenthood clinics were not around in those cities, with the exception of a couple of abortion clinics, there would be 3 or 4 other clinics available to do any women's health or men's health or health of any nature whatsoever. Don't you feel that's true?
Well, I don't, in that I have been to Wisconsin a lot. Obviously, you know more about Wisconsin than I do, but I know we have 22 health centers in the state of Wisconsin, and last year we provided, or the most recent year we have figures, we provided health care to 65,000 people, and actually, I think we are the largest, don't quote me on this, but I will check to make sure, but I think we're the largest family planning provider of the network in Wisconsin, so that's pretty hard to replace.
Well, no, I think you're not answering my question. If you have a city in which there are 4 clinics, full-service clinics that you could go to for anything under the sun, and a Planned Parenthood clinic, I would assume that if the Planned Parenthood clinic disappeared, you would have 4 or 5 other clinics to deal with anything that Medicaid paid for.
We just haven't seen that to be true. I mean, I use the example of the state of Texas where they eliminated Planned Parenthood as an option in communities, and 25% of women lost access to care. So I actually don't think, there are a number of reasons that women go to Planned Parenthood. It's personal choice, as well as availability, as well as the services we provide. And for many women, we are the provider that they think best meets their health care needs. And I do think that's really kind of what's at stake here.
Okay. You emphasized before the lack of ability of access to health care for minorities. Do you feel that you have a special role to fill there?
I'm sorry,
you emphasized,
it's very hard to hear you.
Okay.
I apologize, I think.
But before you emphasized that you felt there was a lack of access of health care to minorities, do you feel that you have a special role to play there?
Now, we have a special role to play for anyone who is underserved, and that includes folks of low income, folks of rural America, folks in areas of the country where there is less public health care access. So it really is all across the gamut.
Okay, I'll give you one more question and come back to the prior one. In Wisconsin, all of the Planned Parenthood clinics are in sizable cities in which there are, as far as I can see, probably multiple other medical providers. Is there anywhere in the country that you know of, any metropolitan area in which Planned Parenthood offers services in which there are no other providers to take Medicaid dollars?
It's just beyond what I know. I can't really respond to that. But I think, again, if we're in 22 communities in Wisconsin, which we are, according to these records, that's a lot of, I'm not saying those aren't all decent-sized cities, but that's a lot of rural community as well.
Thank the gentleman. Now recognize the gentleman from Alabama, Mr. Palmer, for 5 minutes.
Thank you, Mr. Chairman. Thank you for being here, Ms. Richards. Planned Parenthood Action engages in political activity. Is that correct?
The Planned Parenthood Action Fund, which is a separate corporation, does.
And you're compensated by that organization?
Well, I mean, I get compensation really to reimburse for my costs.
No? For brevity.
I'm just trying to explain. I'm sorry.
Yeah, I understand, and I know how these things work, but the answer is yes or no, and I think you've already answered it. It's what, 31,000? Is that about right?
I don't have the figures for last year, but whatever my compensation was, it is for work that I do on behalf of the Action Fund.
Okay, where does Planned Parenthood Action get its funding?
Private donations. We have 8 million supporters in this country and a number of donors from all over the country.
And is there any money from Planned Parenthood that goes to Planned Parenthood Action?
There's the Planned Parenthood Action Fund, it does advocacy and it does electoral work. There is advocacy.
But I know what they do. I'm asking.
Well, I think I'm trying to be responsive to your question.
But
right?
For brevity's sake, and out of respect, for brevity's sake.
For as you know, for 501c4 organizations, they cannot do a majority of their work as electoral work. That's under
I
IRS
understand.
code. And
I
so more than
understand that.
60, I think between 65 and 70% of the work of the Action Fund is non-electoral.
Okay, you also have a PAC. Is that correct?
Okay, yeah, I was just going to one, yeah.
Yeah.
Yes, there is a federal
All right.
PAC.
And that federal PAC, how much, just round figures, what did it spend in 2014?
How much the federal PAC spent in 2014, I can get that for you. I'm
Okay.
not being evasive, it's obviously public record, I just don't have it with me.
Where does the PAC get its money?
It raises its money from individuals.
Are you
and
compensated?
sometimes,
Are you compensated by the PAC?
I don't believe I have ever been compensated by the PAC, although I know that the federal law requires if you are doing work on behalf of a federal candidate, I believe you actually have to, your time has to be paid for by a PAC. So we follow all the,
Do you
all
have
the,
any
all the laws
oversight
and
over the PAC?
regulations.
Do you have any oversight over the PAC? Any managerial responsibility?
Sure, I mean, in the
Okay.
sense that everything
Then
rolls
you're
up.
supposed to be compensated if you do any work for the PAC, and you need to check that out.
Well, I think
I want to go to this. In 2004, you founded a group called America Votes, a coalition of 42 national grassroots organizations focused on elections. How many of these organizations collaborate with or are incorporated into Planned Parenthood's political operation?
I'm sorry, you're asking me about a job I had before Planned Parenthood?
That is
that
correct.
correct?
That
Okay,
was
but can you
focused on
restate, sorry, could you restate the question? I was just out of context.
How many of these organizations are collaborating with or have been incorporated into Planned Parenthood's political operation?
I really don't know.
So I would assume that some do, because you can't answer. It's either a yes or no. Some have, or they're either there or they're not.
I really don't, well, I think you asked me how many, and I said I don't know.
All
I
right,
think
let me-
a lot of these organizations work together, but I don't,
You know,
I could get you, I mean, we could get more information for you.
That would be helpful. You've got these high-paid executives. There's, interestingly enough, 44 of your highest-paid executives make more than any cabinet member. 28 of them make more than any member of the cabinet. You got, that's over 200,000. You got another 11 make over 300,000. That's more than anybody in the cabinet, any Supreme Court justice, the Chief Justice, the Vice President. And you've got 4 that make more than the president, not counting you. Are any of them expected to make political contributions?
By who? I'm sorry.
By you.
No.
Do you direct political contributions to candidates?
The PAC does.
Yes, but do
It
you
votes
have
on
any
it.
input in who gets?
No, but there is a PAC committee that votes on this.
Are you
You're
on that
asking me a
PAC
question,
committee?
I'm trying to respond.
Are you on that PAC committee?
I'm not on the PAC committee.
Do you have any input into who gets political contributions?
No, the PAC committee votes on who gets political
So
contributions.
there's no collaboration between you and the PAC committee? You're setting
I
up the record.
haven't sat on a PAC committee meeting for a long time.
All right, let me
But
ask.
I mean, and
Your PAC
we operate
advertises itself.
absolutely, we meet the federal laws and restrictions.
I appreciate how you want to answer this. Your PAC advertised itself as being nonpartisan, yet in 2014, 100% of the contributions went to Democrats. In 2012, 99% went to Democrats.
I actually don't believe that's accurate.
That's what's reported here.
Okay, well, I'll go back and look, but
All right.
we support, we've done work on behalf of, we
I
support
just-
anyone who supports women's rights.
Mr. Chairman, I'm reclaiming my time. I just want to point out that it's not nonpartisan and that you've given in every case, almost every dime to Democrats, including to 9 members of this committee. Thank you, Mr. Chairman.
Well, we welcome any Republican who supports women's rights and women's health care access, and so, thank you.
Gentleman yields back. We'll now recognize the gentleman from South Carolina, Mr. Gowdy, for 5 minutes.
Thank you, Mr. Chairman. I have a couple of questions for Ms. Richards, and then I'm going to yield whatever's remaining to the chairman. Ms. Richards, Peter Welch sits right down there on the other side. He's a gentleman from Vermont who's a Democrat. Peter and I do not agree on very many issues, but there's not a more well-regarded member of our body, I don't think, and he evidenced that today by making it crystal clear that he makes an effort to understand both the analysis and the conclusions of those who may have a different position from the one that he holds. Do you understand how some of us may, at a base level, disagree with you on the origin of life. Do you make that same effort to understand that my friend from Vermont, Peter Welch, makes?
I fully respect, and I think I spoke to this in my opening statement with the chairman, that I understand people have different feelings about whether abortion should be legal in this country or not. I think it is important that it is legal, and we can disagree. And I know thinking people disagree about abortion, and our goal at Planned Parenthood is to be judgment-free and to allow people, and women in particular, to make their own decisions about their pregnancies.
We're going to get to the judgment-free zone here in just a second, but you mentioned abortion. How about partial birth abortion? Do you understand how some of us may support a ban on partial birth abortion?
Well, I don't want to, I'm not trying to be argumentative, but that was a political formulation, not a medical formulation, but I certainly understand that it was passed and is the law of the land, and Planned Parenthood certainly meets the requirements of that law.
My question wasn't whether you follow the law. My question was whether or not you understand how some of us may be very much opposed to that practice. That was my question.
I understand how people can disagree based on their religious beliefs, their background, their own personal experiences. And I also understand that people sometimes change over time, and that's the human condition.
Are you suggesting those who hold a contrary view to you need to change? Is that why you added that line, Ms. Richards?
No, I've just, candidly, in my 10 years at Planned Parenthood, I've experienced myself people who have picketed outside of our health center and then found themselves in need of our services, and we try not to judge.
And I'm sure that there have been employees who grew tired of participating in the practices that they were participating in, and they may have gone to the other side, might they? How about opposing abortions on the basis of gender or race? Can you understand how people may support legislation that ban that?
As I've tried to say, I appreciate that people have a lot of different views on the issue of abortion, and there's any number of different pieces of legislation you could describe. And I think fundamentally at Planned Parenthood, we take the position that we trust women to make their decisions about their pregnancies. I've made my own decisions as well, and so I feel like I can kind of walk in these shoes.
I appreciate the way you like to frame the issue, that you're the reasonable one, and those of us who have a contrary position are not reasonable.
I didn't say that.
No, that's exactly the last answer you gave. That's exactly what it was, much like your people evolved to a more advanced viewpoint, much like that comment was also directed to that.
Those are not the words I said. I said sometimes people change their opinions.
No, it's not always what you say. Sometimes it's just what you mean.
Well,
in 2014, you disagreed with my colleague's 100% figure. What percent of your money did go to Democrat candidates in 2014 if it wasn't 100%?
I told him I will look. I know that we support Republicans across the country. I wish there were more. I wish there were more Republicans.
Name me some. Name me some Republicans in Congress that you support.
Well, I don't actually want. In this public forum, I'm not going to raise their names because they have been such the target of their fellow party members. But I'm happy to provide that to you later.
Well, the donations are public.
And some of them, yes. I'm not. I don't know in terms of federal office. I was thinking more broadly in terms of support for candidates across the country. I know there are Republicans that we support. And again, we would like to support more Republicans for office. We wish there was, we don't believe that women's health or women's rights should be a partisan issue.
And we don't think eating dinner salads and drinking wine while you're discussing infanticide, we have a problem with that too. So I'm sure you can understand why we would be as viscerally opposed to what we saw on some of the tapes. Would you not?
I just think we may have feel like everything I've answered you see in a different way. So I respect your opinions, and I am always open to listening to other people's opinions.
Gentleman's time has expired. Thank the gentleman. We'll now recognize the gentleman from Iowa, Mr. Blum, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Richards, for being here today. I think it's down to you and I.
No kidding. Okay, we could do this somewhere else. Can
you tell me briefly about your background?
I'm a Texan.
Your professional background.
My professional
That makes you
background. Oh,
qualified
shoot, I
for
thought
the
you wanted to
job.
go back to the beginning, because I was born in Waco, which I'm very proud of. I was a labor organizer for many years with low-wage working women. I eventually had 3 kids, moved to Washington, D.C. I had the honor of working for Leader Pelosi for a period of time here on Capitol Hill. I've started a couple of nonprofits, and then about 10 years ago, I was hired to be the president of Planned Parenthood.
Do you have any accounting in your background, any finance in your background? Do you understand, I assume you understand well accounting?
I have taken accounting courses as part of my, fortunately, my board has been very, very kind and offered me those kinds of, that kind of supplementary learning in my job. But I have obviously we have a chief financial officer, we have an entire accounting department at Planned Parenthood I work with closely.
The reason I ask is in a former life, I was a public company CEO. So I know a fair amount about revenues, expenses, overhead, costs. So I'd like to talk a few minutes with you about that. What's your understanding of overhead?
Well,
what is overhead?
What is overhead?
Yes, what's overhead in Planned Parenthood? What are
Generally-
overhead expenses?
Generally, it's the cost of what things that, just to keep the organization going. Is that what you're?
Salaries, building expenses, rent.
It really depends on, it depends on what you're talking about. If we're in a grant, it can be potentially, overhead could be considered. It really just depends. But yes, of course, all organizations, I assume, and probably in the one you ran as well, we have an office, we have staff, we have electricity.
It must be considerable in a $500 million corporation or a nonprofit. The overhead must be considerable. It has to be to run that big of an organization.
Well, I guess it depends on your definition of considerable, but yeah, we have a very dedicated staff, and we provide health care to a lot of people, education to a lot of people, and so, yes, it requires,
Do you profit or make money on abortion services?
So I think we've discussed this many times, and I'll just try to take it one more time. So I run the national office. We do not provide abortion services. We have provided to this committee, if you're on the committee, all of the financial information about the national organization, our audited financial statements, our 990s.
Your providers
and we've also
make money on
provided
abortion
990s.
services? Your providers, do they make money? Your individual affiliated offices, do they make money providing abortions?
I think
in general.
In general, there is no general. I mean, we are a nonprofit. There's 3 sources of income. There are federal and public
I'm talking
funds,
about
there are
individual
donations,
abortion, though.
and there are,
If someone cannot afford to pay for, what's an abortion cost?
It depends, depending on the state.
What if someone can't pay
Depending on the
for it?
procedure. Excuse me?
What if someone can't pay for the abortion?
We raise private dollars to try to help women who cannot afford abortion services. If they choose that they want an abortion and they can't afford it, we try to raise money to help supplement the cost of an abortion.
Only through private donations. Do you make up the difference, is what you're saying?
Well, I don't,
Correct?
but our 59 affiliates have a variety of what.
Does Planned Parenthood make a profit or make money on reimbursement of Medicaid services?
We don't make a profit on anything, but in terms of Medicaid.
Well, it depends on how you,
Okay.
you have 127 million
Let's talk about Medicaid.
excess dollars
Medicaid's
every
very
year.
easy. Yeah, Medicaid's very easy. Medicaid reimburses, and as you know, across the country, Medicaid rates vary widely. In some states, they come closer to paying for the cost of the services. In a lot of states, we actually have to raise private donations to supplement what it costs for.
So you may make money on some Medicaid reimbursement services, correct?
I don't know that anyone does, but I'd be happy to find out.
And I'm sure you're well aware it's against federal law to use taxpayer funds for abortions, except for rape,
abundantly
incest,
clear on
life of the mother.
that, and
So
we're
are
heavily
you-
regulated as HHS regulates.
Are you saying
Medicaid.
today with 100% surety that not one dime of taxpayer money is used to provide abortions?
What I said earlier?
I mean, yes or no? 100% surety?
No, because actually,
that is against the law.
the federal law allows for federal dollars to pay for abortion services in very rare instances.
Correct.
Rape,
So other than those
incest,
instances.
in the life of the mother. We don't use any federal dollars for any abortion services except for those that are
What about the profits generated
permitted
from
by
those federal
law.
dollars? Are any of those used to cover abortion services?
Sorry, we were kind of talking over ourselves. You have to repeat it. I just didn't hear
The
you.
profits generated from taxpayer-funded sources such as Medicaid reimbursements. Are any of those profits
I don't
used
believe-
to help cover the costs of abortions?
And I don't believe there, I will absolutely, we can go through all of our 990s, happy to go through with the committee, but I don't believe there are any profits from any Medicaid services in this country. As I've said, that's one of the issues we're addressing here is there are too few people willing to take Medicaid patients because often the Medicaid payments do not pay for the cost of birth control, a pap smear, a breast exam, and the like.
And what's critically important is how you apportion or apply the overhead services.
The gentleman's time is
I yield back.
Thank you. We'll now recognize the gentlewoman from Tennessee, Ms. Black, for 5 minutes.
Thank you, Mr. Chairman. I thank you for allowing me to sit in on this committee, and I thank the witness for being here today. Ms. Richards, on September the 18th of this year, you stated that H.R. 3134, the Defund Planned Parenthood Act of 2015, would, and I quote, block access for folks who deserve high-quality, compassionate care, close quote. Now, Ms. Richards, I would like an opportunity for you, as I ask you these questions, to give you an opportunity to change these false claims. So I wrote the Defund Planned Parenthood Act of 2015. So let me tell you what it does do. It does not reduce public health funding by a single dime. And it would, in fact, increase that funding for community health centers by $235 million. Were you aware of these facts when you made that statement?
Congresswoman, we've discussed many times today that, in fact, the Congressional Budget Office estimated that if women were denied the ability to go to Planned Parenthood, 390...
Reclaiming my time, you said it would block access. It would block access. Now,
for our patients,
yes
it would
or no,
block
Ms.
access.
Richards, do you acknowledge that community health centers outnumber Planned Parenthood clinics by roughly 20 to 1?
I don't know the exact number. I know there's more community health centers than there are Planned Parenthood.
So you will acknowledge that they outnumber Planned Parenthood clinics?
I'm happy to acknowledge that.
Okay. And yes or no, Ms. Richards, do you acknowledge that these facilities funded under my bill provide a broader range? These facilities actually provide a broader range of services than what is offered at Planned Parenthood, for instance, mammograms?
I'm not an expert on what all community health centers provide. I know we work in close collaboration with them, and in fact, often they send us their patients that they can't see for birth control.
But you will acknowledge that you do not provide mammograms, which was acknowledged in this committee today.
We've never made any.
So that would say that they do actually provide more extensive services than what you provide there at Planned Parenthood.
I don't know.
So,
what I said to you, though, is I don't know what all the community health centers provide. We're very clear about what we do provide at Planned Parenthood and about the number of women who voluntarily choose to come to us because of our care.
Again, because I have just a very short period of time. So knowing that the House-passed bill actually increases public health funding and redirects those federal dollars to clinics that offer more preventative health care than Planned Parenthood, you can't substantiate your claim that the bill blocks access to care. It does not block access to care. Now, I do want to just end this by saying that you had a statement that you made that quality, affordable health care is your entire mission. And you made that statement. I actually wrote it down when you made it. Why would you not make an executive decision then to temporarily discontinue your abortion services, which only represents, by your testimony, 3% of the services that you provide, and continue providing what you consider to be your entire mission of 97% of the services provided?
Well, because abortion is a legal service in America, and we think it's important that women, you quoted me as saying quality, affordable health care, and that includes access to quality and affordable abortion services as well.
But you acknowledge that, do you say abortion is health care? Do you consider that
Yes,
health care?
it's a health care service for women. In fact, 3 in 10 women in this country have accessed an abortion.
So you
at some
define
point.
health care, abortion as health care?
It absolutely is part of women's health care, and women will tell, I think women would agree.
Well, if I'm a nurse, and if you look at medicine, abortion is not health care. It is not considered to be health care. Now, let me turn
We
to
just
one other
simply
thing.
agree to
that
disagree on this
you
matter.
Well, let's look at the definition, but let me just finish up here, because you've continued to say that these videos were doctored. Are you aware of a report that just came out today that has been released by Coal Fire that shows in their report, and they say the forensic analysis removes any doubt that the full-length undercover videos released by the Center for Medical Progress are authentic and have not been manipulated. Analysis scrutinized every second of the video recorded during the investigation and released CMP to a date and found only bathroom breaks and other non-pertinent footage had been removed. I would say if you were to compare the two companies now that have done this investigation, you see Coal Fire has reported on every second of those released audio and video investigation footage, as opposed to the Fusion report, which only had 4 full-length videos. So I think this discussion, Mr. Chairman, is still yet to be had about just what these videos do show and the fact that they perhaps coming from Fusion are not doctored. Thank you, Mr. Chairman. I yield back.
Thank the gentlewoman. The end is in sight. Ms. Richards, you've been exceptionally kind with your time and generous. We have a couple of cleanups that we need to do here, a couple other questions, and then we will be concluding. We'll start by recognizing the gentleman from Ohio, Mr. Jordan.
Ms. Richards, since the videos surfaced, has anyone from CMS or HHS contacted you, any of your board members, or any of your staff?
Since the videos surfaced
July 14th, and has anyone from the Health and Human Services or CMS contacted you? Or anyone on your staff or board?
I don't know. I don't know.
We need to answer that.
I mean, we have a very big staff. So.
Has anyone from the Inspector General's office at HHS contacted you, anyone of your board, anyone of your staff?
If you're going to ask me about everything, about any contact with we have a big board and we have a very big staff, so I'm happy. I can't really answer.
Has the Attorney General of the United States, Loretta Lynch, contacted you?
No.
Contacted Planned Parenthood? Anyone at Planned
Well,
Parenthood?
she may have. I don't know.
You don't know?
I have hundreds of staff, and we have a very large
anyone
board.
from the Justice Department contacted Planned Parenthood since the videos surfaced?
And I'm telling you, I don't know if you're asking about everybody that's involved in Planned Parenthood.
You don't know? So, I mean, if the Justice Department would contact Planned Parenthood, it seemed the person who's in charge of Planned Parenthood would know the answer to that question. You don't know?
Well, we have a very large staff, and so
but
you're asking me.
You're here testifying the videos and the funding and everything else in front of a congressional committee, and I'm just asking.
Mr.
I mean, there's potentially 4 crimes that potentially, we don't know, but 4 crimes made: transferring fetal tissue for valuable consideration, changing the procedure to solely obtain tissue, doing this without patient's consent, and performing partial birth. There's potentially 4 federal crimes, and all I'm asking is, has the Justice Department contacted you?
What you asked me not is whether they had contacted me. You asked if they had contacted anyone at Planned Parenthood or anyone on our board.
You're here representing Planned Parenthood. Have they contacted Planned Parenthood?
And I said to you, I will find out. I don't know.
Since the videos have surfaced, have you had any conversations with the President of the United States?
No, I have not.
Since the videos have surfaced, have you been to the White House?
No, I have not.
How many times have you been to the White House?
During what period of time?
Since Mr. Obama has been president.
I don't know. That's been, I think, 7 years, so I would have to get back to you on that.
Our count shows that you, your board members, and senior staff have been in the White House 151 times in 6.5 years. I'm just curious. That's why I asked the question, if you've been to the White House or you talked to the president since these videos have surfaced.
And I said I had not.
And you'll get back with me on if the Justice Department has contacted you since these videos have surfaced.
Well, I think you listed several folks, so I'm happy to work with the committee and find out what all you need to know.
CMS, HHS, Inspector General, Justice Department. Justice Department is the most important.
I'll work with the committee staff and work with my team.
I would thank the chairman. I'll yield to the gentleman from South Carolina.
Thank you, Ms. Richards. I want to follow up very briefly on the line of questioning that Mr. Clay had earlier this afternoon. He asked you if there were any federal funds being used in what he termed the tissue transfer program. Do you remember that question, ma'am?
I'd be honest, it's been a long day.
That's fine. Well, he did ask you, and I think in my recollection is that you said no. And then you paused, and then you said, not that you were aware of. And then he continued the question. that caught my attention, because it struck me that
Okay.
the answer to that question should be an unmitigated no, not that you are or I am aware of. So
Well, I
the answer
certainly
is-
don't believe so. Again, I've been here for several hours, and so I've just
Fair
been
enough, but let's start
trying
from
to be,
scratch and just say,
just trying
are
to be
you,
very careful.
okay, are any federal funds being used in relation to what we have described here today as the tissue transfer program?
I do not believe so.
Okay. Since that is other than an unmitigated no, I'm going to ask you some follow-up questions. Have you done any investigation to find out if federal funds have been used in that program?
I don't believe they have been, and so there hasn't been any need for any investigation into that. But I'm certainly happy to get back to you on it.
No, you have to, I think you answered the question. I asked you if you had done any investigation, you said no.
Well, because I don't think it's been a,
Fine. I mean, that's your motivation. You may not care, but the answer to my question
I
is
did
no.
not say I do not care, and I sort
You
of,
could say you couldn't have time, but the point of the matter is you have not done any investigation on this point, correct?
that's not what I said. I said I'm not aware, and I will absolutely be happy to get back to you. And it's
then
not
let
because
me-
I don't care, and it's not because I don't pay attention.
Again, not
at
trying to put
all.
words in your mouth, Mr. Richards. Let me ask the question again. Have you done any investigation as to whether or not any federal funds have been used in the tissue transfer program? Okay. By the way, who's the bald guy sitting behind you? Is he a lawyer?
I'm a lawyer.
Okay, that's fine. What is your name, sir?
Planned Parenthood.
Okay,
Hold on.
that's fine. I just want to know who you are, because you
The
actually.
questions that go to the witness.
Okay, then I'll ask.
Okay,
the
I'm
witness.
happy to get back to you on this, and
No,
I really.
No. I'm asking you a question. Have you?
And I think
as
I've
you-
answered it as many times as I can answer, and I'm sorry that my answer isn't satisfactory to you. I've been here 5 hours now, and I'm
Right.
trying to just make sure I'm as responsive as I can be. So
Okay, so just so the record is clear,
And I-
because there's a young lady here making a record of this, I'm going to ask the question one more time, and then you can give me the answer that you deem to be responsive to this question. Have you made any investigation into whether or not federal funds have been used in the transfer of fetal tissue or fetal parts?
I have not made any investigation to that specific question.
Okay, thank you. Is it possible
I
then
think-
that federal money is being used for that program?
I don't believe so.
But that's not based on an investigation, is it?
I feel like we're kind of I think we're just keep repeating the same question.
Okay.
So
No, thanks.
I don't
In
think
fact,
that was a question.
No, it'll
actually.
end the discussion today, but it certainly won't end it. Thank you, Mr. Chairman.
I thank the gentleman. A few things just for follow-up. Just so we've had an hour's worth of discussion, there are some things that we would like to follow up. So I'd like to go through that list as we conclude, and we'll recognize Mr. Cummings, and then I will wrap up. We would like to get the name and number of affiliates that receive the majority of their revenues from abortion services. If there's clarification as to what we are looking for, let me know, but that is one question.
I'm just going to try to write it down. As
Yeah,
you go.
and you got plenty of staff there to write it down. I don't mean to have you take notes, but if you have a question, I want you to be able to ask me as we're kind of doing this. We are looking for the amount of revenue by affiliate for abortion services. So you had that should be pretty straightforward. We would like to know which affiliates provide which services.
I believe you have that, but we're happy to provide that.
We're still, we want to make sure we've got it crystal clear. I think we have portions of it, but we don't have all of it.
Okay.
The names of organizations and the countries that Planned Parenthood gives funds to overseas. So based on the tax returns and reports, you're sending money to overseas. Some of them have been listed as investments. Some have been listed as other things. We'd like to get some detail and specificity as to how much is going to which countries and what those are for. Is that fair?
I really have to talk to my team about that, but I will.
Is that, okay.
And I'm happy to talk to the committee staff about what it
That's
is they're
great.
trying
A lot of this will be follow-up with committee staff. I just want to make sure that we're on the record what we're asking for. We obviously have some concerns about the Planned Parenthood Action Fund. So we're trying to get to the duties performed and compensation received for all Planned Parenthood or affiliate employees. This can be either by for the Planned Parenthood Action Fund or for either of the, I believe there are two 527 organizations. One of our concerns is the shared services and the sharing of employees between political activities and non-political activities. And we would like to understand how broad and based that is.
Okay.
Okay. The cost of reimbursement for both contraception and abortion obviously breaks down into in-clinic as well as the pill.
Actually, there's a lot of other kinds of contraception, too.
Yes. Contraception I left as broad as I could, but for the abortion
I'm
services.
just saying, I think it's important. I'm not sure we really got into much of that conversation about how birth control, how many different kinds of birth control there are now, because it's one of our specialties.
Well, help us understand what services and money you're allocated, what the costs of that are. Because there were some points that should be helping to drive down those costs, and we're just not understanding the ratio and
yes,
why.
I think there was some, I mean,
Yeah.
that's why
it needs clarification.
As I
I'm
came
not
up,
asking for it.
it was clear that folks weren't aware of the various costs of different kinds of contraception.
Exactly, and that's where we need help. Not right now, just as a follow-up. We would appreciate, the travel seems excessive to us. Now, we're looking at it from afar. There may be a very plausible explanation. But when you have a nonprofit organization who says they're trying to put every dollar they can towards women's health, and then people are buying first-class tickets and getting private aircraft and chartered aircraft, we'd just like to have an explanation of that.
Yeah,
Fair
I have
enough?
no idea where that's coming from, but I'm making the list.
It's in the tax
I'm making the
returns. That's
list.
where we see it. That's where we see it. There's boxes to check for certain things, and we would appreciate some clarification.
Happy to provide.
A list of political organizations Planned Parenthood collaborates with, including the names and compensation of received of shared employees. I think I covered that in general, but I'll keep going. You understand what our question there is. And then if there are political donations to Democrats and Republicans, I think most of that is probably financially, publicly disclosed, but if you could help us with that. That's a lot. Let me yield now, or let me recognize the gentleman from Maryland, and then we will wrap up.
As I listen to the questions that you have to answer and the information that you've just been asked to provide, I cannot help but think about the IRS. Our Republican friends said that there were certain organizations that people in the IRS didn't like. They even accused the president. And then they decided today, they said it was unfair. And I understand what they were saying, to go through and ask the same kind of things that he's asking you for. I just want to make, it just hit me as I'm sitting here and I'm listening to all of this. I think it's something that we ought to give some serious thought to. Ms. Richards, I want to thank you for your testimony. You know, as I was sitting here, I was just thinking about some questions that were asked of you earlier. And the implication was, in even asking the question, that you do not respect those who may have a different view with regard to abortion. And you know, I think that is so unfair, because I think I have heard very few people in this Congress ridicule us if one group believes that a woman should have control over her own body and should be able to choose abortion if she likes, if she and her family and her, her God, if she makes that decision. And then there are other ones who don't believe in abortion. I have not, and I've been here 20 years. I think we basically respect each other's opinions, period. I mean, is that right? I mean, do you respect, because a lot of this is a real personal thing, am I right?
Absolutely, it is.
But there's one thing that we seem to be sort of glossing over and sort of moving around. It is the law.
I mean, it's the law. You may not like the law, but it's the law. And you are doing what is within the bounds of the law. And, you know, there are a lot of things I don't like. A lot of laws I don't like. But I still live in the United States of America. And there's a system of government. And I, as a lawyer and as a member of the Congress, I'm sworn to uphold those laws. Now, I might want to change them. I'll do everything in my power to change the ones I don't like. But in the meantime, that's where I am. So I just want to make sure that, you know, that nobody walks out here saying, oh, you know, because people have differing views, does not mean you don't respect the other person's view. I've never gotten that impression from you. I've read a lot of things you've written, and so is that accurate? Is that a fair statement?
Well, I hope I've showed today, I have total respect for this Congress. I have respect for people of different points of views. And I really think that's, it is important that we show respect for people who may make different decisions in their lives. And I think we need less judgment and more empathy in this country for people who may simply have different circumstances that we can never know about.
Now, Mr. Chairman, I just have a few questions of you so that we'll be real clear. I'd just like to ask a couple of clarifying questions to help our members understand what our next steps are. Republicans have announced that they plan to establish a new select subcommittee, and I don't know how much you know about all of this, but I got to ask, to take over this investigation. The question is, will that subcommittee have jurisdiction going forward, or will the Oversight Committee continue this investigation of Planned Parenthood? Do you know?
It's the intention of the committee to continue to pursue on the duly issued subpoena and obtaining all of the videos. According to the information I have from the speaker, the body will consider a bill. I think it's a bill. Maybe it's under a different structure next week for the formation of this select panel. It may be empowered with subpoena authority. We're not sure. Haven't seen that yet, but the speaker indicated this morning that will come before the body next week.
As we both know, when the Benghazi Select Committee was created, all of the standing committees had to turn over all of their records to the Select Committee. Is that what we are going to do? Is that consistent with what you know so far?
I don't know.
All right. And do you know whether this new Select Committee, subcommittee, will be given additional taxpayer funding to pay to investigate the Planned Parenthood?
I don't know the structure, I don't know the length, I don't know the powers, and I don't know the funding.
My last question, and I was unclear on your response to a question on this earlier. Do you plan to invite Mr. Daleiden to testify? And if so, when do you plan to do that, if so?
We need to, clarify the disposition of the videos. Given that there's a temporary restraining order, we need to have that loosened up. When we obtain all of those videos, we'll work in partnership with you and develop a plan on how to deal with those. I don't know with the structure of this new select committee how that affects it, but we'll cross that bridge when we get it. The first step is to obtain all the videos, and I'm glad to see you agree with us on that.
Yes, definitely. The reason that I'm asking is because all of the Democrats on this committee have requested a minority day of hearings with Mr. Daleiden under the House rules. If our committee is going to yield to the new select subcommittee, then we may consider withdrawing our request. But if our committee is going to continue, in addition to the select subcommittee, then we may very well insist on our rights to have Mr. Daleiden testify. Can you shed any light on this?
Again, the first step is getting all the videos, and at that point, we'll make a determination.
To preserve our rights, I'm going to submit our September 21st letter for the record requesting a minority day of hearings. But I look forward to talking with you further about this issue as we've been working together extremely well. But I want to make sure I protect our members' rights.
Very good. I appreciate it.
And last but not least, again, Ms. Richards, I want to thank you for your cooperation. You have been extremely cooperative. We have not always had that you got a lot of compliments from up here about the cooperation you have provided, and we really do appreciate it. And on behalf of so many women, people like my mother-in-law and so many others, I want to thank you, because I know of so many women who, if it were not for Planned Parenthood, would be in a terrible way. And so thank you very much.
Ms. Richards, again, thank you for your participation here today. You've been very generous with your time. I think you've honestly tried to share your thoughts and perspectives. I know it's hard and a long day, but we do appreciate your willingness to voluntarily come, provide your testimony in advance, all the things that we look for. We do appreciate that. With that, the committee stands adjourned.
Thank you.